Good evening, everyone. Distinguished guests, esteemed colleagues, and dear participants. It is with great pleasure that I will welcome you all to the Dharaka National Seminar 2024, a significant milestone in the ongoing journey of Ayurveda. Today marks the beginning of a new chapter in our collective effort to advance the field of Ayurveda. As we gather here, it is essential to recognize the growing importance of deepening our understanding of Ayurvedic science. In this ever evolving world, our responsibility to elevate Ayurveda goes beyond merely possessing knowledge. It is also demands that we master the art of conveying its significance with clarity and confidence, regardless of the circumstance. This seminar has been thoughtfully designed as a platform where we can come together to refine our skills, share insights, and contribute to the continued growth of Ayurveda. It's a space where the ancient wisdom of our tradition meets the demands of the modern world, ensuring that our heritage continues to thrive and inspire. Before we proceed, I would like to take a moment to express my sincere gratitude to the dedicated panel members who have worked time tirelessly behind the scenes. Their unwavering commitment and round the clock efforts have made this event possible, and for that, we owe them our heartfelt thanks. Without further ado, let us now embark on the journey we have all gathered here for starting with our first presentation. First, I would like to invite Dr. Sahili Hiraman Pawar for the paper presentation.
Good evening. Myself, Dr. Sahili Pawar, second year PG scholar, SRPT Department, YSC Kolhapur. Today, I am presenting scientific approach of diet in Masanumasik Garbhini Paricharya for a healthy progeny and pregnancy under the guidance of Dr. Smita Chodankar, Associate Professor, SRPT Department, YSC Kolhapur, and HOD Dr. Vishala Turlapati, Professor and HOD, SRPT Department, YSC Kolhapur. Introduction. Ayurveda for pregnancy is totally scientific and are specific to fetus and mother. Masanumasik Garbhini Paricharya aims at excellence in the formation of fetus, its development without anomalies, a secure full-term delivery and maintenance of health of fetus. Following Garbhini Paricharya, the woman remains healthy and delivers child possessing good health, energy, voice, and compactness. The monthly regimen is necessary to make pelvis, waist, sides of chest, back healthy and flexible, and a downward movement of Vata Anuloman. This is needed for normal delivery, normalization of urine and stool, and their elimination. First month, Garbha being in Kalal, liquid form, and etiquette net nutrition by Upasnehan. So, Garbhini should take a proper diet to make balance of Rasa and Rakta Dhatu. Women experience nausea and vomiting, couldn't take a proper diet. This form of embryo needs stability. Early embryo is rich in sugar and polyp in its fluid compound. Fat and water-soluble proteins helps in rapid cellular growth. Milk, cold liquid diet. Medicated milk is mainly advised, which helps to relieve vomiting, dehydration, anemia that arises in first month. Use of sweet liquid diet and provide nourishment, prevent dehydration caused by vomiting. Madhur drugs being anabolic helps to maintain the health of mother and fetus. Dravyas used in first month are kapha vardak. Kapha is responsible for stability. Second month, osteogenesis begins at this month, in which corticosteroid drugs like Shatavari, Kakoli are rich in corticosteroids. Bone development, protein catabolism, carbohydrate metabolism. Prajastapana drugs are given. These drugs are rich in progesterone, which helps in maintaining pregnancy. Progesterone prompts endometrium to provide nutrients to the developing embryo. Third month of pregnancy is known as Gatra Panchak Vyakta Avastha, that forms all the sensory and motor organs of fetus. Honey is supersaturated aqueous solution of sugar, vitamin K, and minerals. Honey has a capacity of Sushma Marga Anusari that helps the nutrients rich very minute channels. Ghee regulate DNA products and cellular communication, helps in development of CNS. Fourth month, Anga Pratyanga gets formed, increase need of nourishment, milk navneet useful for bihan. Meat soup from fourth month, muscle tissues grow. It requires more protein which is supplied by meat soup. Butter having high amount of saturated fats provide good dietary allowances of vitamin A, which is needed for the vision health and helps in myelination of neurons as in 13th week, development of sensory motor cortex occurs. Fifth month. Fifth month is known as Mana Prabhuddha Avastha, during which time mental development of fetus occurs. To overcome the need of fetus and mother, Balya Dravyas like milk, ghee is used. Ghee is Agni Ripak that helps in Shuddha Vriddhi and ultimately will increase intake. Most cortical gyri and sulci begins to attain shape in between 22 to 36 weeks. Neurons and epidermis develop during this month, hence ghee is very useful. Sixth month, Gokshur is good diuretic, prevent water retention and complication of preeclampsia. It is also Ojovardak. In second trimester, muscular tissue of fetus grows sufficiently through cellular hyperplasia and cellular hypertrophy. Hence, it requires more protein which can be supplied from animal sources like meat, milk, cheese, butter, as furnish amino acids in optimal combinations. Meat and dairy products have long been considered nearly ideal sources of nutrients, especially protein and calcium for pregnant women. Meat helps in maintenance of pregnancy, provides nourishment to fetus, and suppresses alleviated vata of pregnant women. Seventh month. Seventh month of pregnancy is named as Sarvanga Pratyanga Vyakt Avastha Pruthak Paryayati Varga. This Varga is diuretic, anabolic, suppresses pitta, kapha, relieves emaciation, helps to maintain health of mother and fetus. Drugs like Vidarikanda are given to provide more strength, relieves acidity, refluxes, and respiratory bronchioles are more mature in this month. Eighth and ninth month. Eighth month of pregnancy is known as Sancharan Avastha, action on uteroenteric nervous system. Yavagu rice gruel being light doesn't produce burning sensation. If used hot, it produces movements of doshas in proper direction, suppresses the pitta by its sweet property. Milk and drugs of Madhura Grupa have been advised for the entire period. Milk is complete food and the drugs of Madhur group are anabolic. Thus, use of this will help in maintenance of proper health of mother and growth of and development of fetus. 9 months of prasav avastha, use of uncautious gruels, meat soup of wild animals, and Vivid Anna were prescribed by acharyas in this month for the nourishment of mother and fetus. Discussion and conclusion. Milk and drugs of Madhur group have been advised for the entire pregnancy period. Milk is wholesome diet. It provides nutrition and stability to the fetus. These lipophilic molecules cross the blood-brain barrier. Anabolic diet is essential for organogenesis. Folic acid, ashwagandha, shatavari helps formation of neural tube, prevents neural tube defect. Concept of Garbhini Paricharya is programmed with an objective of birth of Shreshtatam Apatya. The benefits of this entire regimen ensures the procurement of Supraja. Thank you.
Thank you, Dr. Sahili. Thank you for the wonderful presentation. Next, I would like to invite Dr. Nikita for the paper presentation. Dr. Nikita, are you there? Dr. Nikita, are you there? Okay, next is a poster presentation. on the topic case study on Gridhrasi with respect to sciatica. I would like to invite Dr. Vidhi M. Desai for the poster presentation.
Good evening, everyone. Myself, Dr. Vidhi M. Desai, second year PG scholar from Parul Institute of Ayurveda, Faculty of Ayurveda, Parul University, Vadodara. Today, I am presenting a case study on Gridhrasi with special reference to sciatica. Abstract. Gridhrasi is one of the most common disorders of Vata, which closely resembles with sciatica, which is characterized by pain or discomfort associated with sciatic nerve. It is a single case study. A 43-year-old man who was already diagnosed with intervertebral disc prolapse in L4, L5, correlated with Gridhrasi of left leg since 7 months. Approached to Ayurvedic hospital and was treated with Panchkarma treatment including Dasamuladi Niruma Basti, Kati Basti, and Patra Pinda Potli Swed, along with Saman Chikitsa. The treatment was continued for consecutive 1 month. Symptomatic assessment of patient was carried out after 1 month and satisfactory outcome was there, and overall quality of life of patient was significantly improved. The aforementioned therapy gives symptomatic relief for the management of Gridhrasi. Introduction. One of the main causes of low backache is the intervertebral disc prolapse. In 95% of the lumbar disc herniation, L4, L5, and L5, S1 disc are most commonly affected. In intervertebral disc prolapse, the pain may be located in the low back only or referred to a leg, buttock, or hip, which outline the features of sciatica syndrome. Sciatica is a strike pain which causes difficulty in walking. It hampers the daily and routine and deteriorates the quality of life of the patient. The cardinal signs and symptoms of Gridhrasi are Ruk, pain, Tod, that is pricking sensation, Muhur Spandan, that is tingling sensation, Stamba, stiffness, and the Spika, Kati, Uru, Janu, Janga, and Pad in order, and Sakti Kshipani Graha, that is restriction in the upward lifting of the lower limbs. In Gridhrasi, Tandra, that is drowsiness, Gaurav, that is heaviness, and Aruchi, that is anorexia, may be present if a kapha is associated with Vata. Now the history of the patient. History of a present illness. A 43-year-old man was apparently healthy before 7 months. Then he started complaints of the pain in the lower back region and then gradually radiates to posterior aspect of thigh, knee, and calf region and foot of the left leg since 6 months. He also had complaints of stiffness in the lower back region and left leg since 6 months. Tingling sensation in the left leg, heaviness in both legs, and difficulty while walking and bending forward since 5 months. Simultaneously, he had pain in the cervical region for 3 months. Along with above complaints, he had associated symptoms of loss of appetite, gaseous distension of abdomen, constipation, sore belching, and fainting intermittently. Past history: continuous jerk to low back region while driving auto for long distance, that is around 2000 km in 5 or more days in a week. No history of trauma or fall, no any history of hypertension or DM, no any surgical intervention. Now patient had investigation, that is magnetic resonance imaging MRI of lumbosacral spine with screening of whole spine reveals osteoporotic spine with diffuse circumferential disc bulge at L4, L5 disc level, and early spondylodegenerative changes in L4, L5 span. On examination, inspection, patient had a limping gait, palpation, tenderness at L4, L5 region, and range of motion, forward flexion painful, right and left lateral flexion is also painful, and SLR, right leg has 40 degree, which is positive, and left leg has 30 degree, which is positive. Now, Chikitsa, Sodhan and Saman Chikitsa both are given. Sodhana Chikitsa, Sharvang Abhyang with Karpuradi Tel followed by Nadi Swed. Nadi Swed, which is done by the Smul Kwath. Sarvang Patrapind Potli Swed, which is done by Nirgundi, Ark, Erand, and Shigrupatra. Then Kati Basti with Karpuradi Tel and Kalabasti. In Kalabasti, Niru Basti was given with Dasmul and Punarnavadi Kwath 500 ml, Ashwagandha and Guduchi Kal 20 gram, Sahachar Tel 50 ml, Sandolavan 10 gram, and Madhu is 50 ml. And Anuvasan Basti given with Sahachar Tel, which is 100 ml. And Saman Chikitsa, Agni Tundivati 2 tablet before food 2 times, Trayodasang Guglu 2 tablet 2 times after food, and Rasna Saptakwat 15 ml with 45 ml of water 2 times before food, and tablet Sallaki 1 tablet BD after food, and Gandharva Haritaki Churna, which is given at night, dose is 10 gram. Now, observation and result. After completion of 1 month of total Ayurvedic therapy, Sodhana and Samana Chikitsa, the patient had found significantly relief in the lumbar pain, tingling sensation, and heaviness with increased range of movement of the spine. Gait was also improved. The patient got complete symptomatic relief. Also, now discussion. Chikitsa Sutra of Gridhrasi involves Basti Karma, Siraved, and Agni Karma Chikitsa. The treatment protocol, which was planned for this patient, can be divided into Sodhana Chikitsa with Basti Karma along with Samana Chikitsa. The treatment principle applied for the management of this disease condition are Vedana Sthapan Chikitsa, that is analgesic, Sodhara Chikitsa, that is anti-inflammatory, and Vata dosa pacifying treatment along with straightening and nutritive therapy for the various musculatures and structures in the lumbar region and lower extremities. The probable mode of action of this aforementioned Sodhan and Saman Chikitsa can be explored. Thank you.
Thank you, Dr. Vidhi. Thank you, Dr. Vidhi Desai. Thank you for the wonderful presentation. Next is a paper presentation. I would like to invite Dr. Baliram Janardhan Raut for the paper presentation.
Baliram Janardhan Raut from Chile Department. My topic is comparative clinical study to evaluate the efficacy of Panchsama Churna and Vyoshadi Churna in the management of Arsha with special respect to first and second degree of internal hemorrhoids. Introduction. In today's society, unrelated diseases have emerged quite common. Progressive nature according to Ayurvedic concept. Etiology of Arsha, interconnect to mandagini of patient. Few important causes: sedentary lifestyle, irregular bowel habits, low fiber diet, low understanding, etc. Need of study. The prevalence rate of hemorrhoids are 4.4%. Number of patients increasing in the society because sedentary lifestyles, intake of spicy foods leads to complication with hemorrhoids. Basic chikitsa is one of the part of treatment mentioned in the Arsha. Panchsama Churna content, Sushti, Haritaki, Pimpali, Trivruttadi, Saurti. This is mentioned in the Charandra Sita for the management of Arsha. Vyoshadi Churna is mentioned in the Basic Ratnavali. For Arsha, it's Vyoshadi Churna. Balatak, Vidanga, Pila, Haritaki. This is all drugs from the Panchsama Churna, Vyoshadi Churna, having Tikta Katuani, Rasatmaka, having Agnidipaka, Pachana, Raktastambaka, Sangrahi. All the present drugs easily cost effective and cheap. Therefore, all present study will be selected for the objective, primary objective. To compare the effect of Panchsama Vyoshadi Churna in the management of the Arsha with special respect to first and second degree of internal hemorrhoids. Secondary objective to assess the effect of Panchsama Churna to management of Arsha with special respect to first and second degree of internal hemorrhoids. Methodology. Method of selection of study material, inclusion criteria. Patient having first, second degree will selected. Patient is less than 8 gram. Inclusion criteria. Patient having age between 18 to 16 years were taken. Selection of patient will be done in respect to sex, socio-economic, and religion. In exclusion criteria, known case third and fourth degree of hemorrhoids, patient with SB less than 8 gram percentage, pregnancy, known case of HIV, SBCG, patient below 89, above 60 years are excluded. Withdrawal criteria, patients irregular in follow-up, patient themselves want to withdraw from the study if patient having complication. Drug regimen, Panchsama Churna, Vyoshadi Churna. Panchsama Churna एक कश्य, Vyoshadi Churna एक कश्य. 7 call. Panchsama Churna अधोभुक्त, Vyoshadi Churna अधोभुक्त. अनुपान काल, उष्णजल, आणि Vyoshadi Churna गुडा. Study duration 14 days. Criteria for assessment, subject to criteria. Raktasrav, Malaostombo. Objective criteria, frequency of bleeding per annum, piles mass, size of pile mass, and number of pile mass. Assessment of subjective criteria. Raktasrav, amount of bleeding per annum, criteria, gradation. No bleeding, 0 grade. Soiling of faces with blood, staining of hand on clean after defecation, 3rd degree. Drop by drop, 5 to 10 drop, 2nd degree. Drop by drop, more than 10 drop during defecation, 3rd degree. Places in the pan and jet of blood, 4th degree. Investigation, SB, PDCT, assessment of clinical result. Overall assessment, improvement in result, poor environment, less than 25% relief in sign and symptoms, mild improvement, 26 to 15% relief in sign of symptoms, moderate improvement, 15 to 75% relief in sign of symptoms, marked improvement, 76 to 100% relief in
Thank you, Dr. Baliram Janardhan. Thank you for the wonderful presentation. Next, I would like to invite Dr. Nikita Gunvant Khandekar for the paper presentation. Dr. Nikita, are you there? Dr. Nikita, please unmute, doctor. Once
Okay.
again, please unmute, doctor.
Hello.
Good evening, doctor.
Good evening, sir. Am I audible?
Yes, doctor, audible.
Okay. Should I start, sir?
Sure, doctor, please start.
Okay. Okay. So you would be sharing my PPT or I have to share?
I will share for you, doctor.
Okay.
Please start the session, doctor.
Okay. Okay. Good evening, everyone. Myself, Nikita Khandekar, PG Scholar Kriya Department, GAC Dharashiv. My topic name is Physiology of Pain. Next. So, pain is defined as an unpleasant and emotional experience associated with or without actual tissue damage. It is described in many ways like sharp, pricking, electrical, dull ache, shooting, cutting, stabbing, etc. Next. Okay, so pain is produced by real or potential injury to the body and it is expressed in terms of injury. For example, pain produced by fire is expressed as burning sensation, and pain produced by severe sustained contraction of skeletal muscles is expressed as cramps. Next. So pain may be acute or chronic. Acute pain is a sharp pain of short duration with easily identified cause. Often it is localized in a small area before spreading to neighboring areas. And it is usually treated by general medications. Chronic pain is the intermittent or constant pain with different intensities. It lasts for longer periods. Next. Now, benefits of pain sensation. It is an important sensory symptom, though it is an unpleasant sensation. It has protective or survival benefits, such as it gives warning signal about the existence of a problem or threat. It also creates awareness of injury. Pain prevents further damage by causing reflex withdrawal of the body from the source of injury. It forces the person to rest or to minimize the activities. Thus, it enables the rapid healing of injured part. Next. Components of pain sensation. It has two components, fast pain and slow pain. Next. So fast pain is the first sensation. Whenever a pain stimulus is applied, it is experienced as a bright, sharp, and localized pain sensation. Fast pain is followed by the slow pain, which is experienced as a dull, diffused, and unpleasant pain. Receptors for both the components of a pain are same, that is, the free nerve endings, but afferent nerve fibers are different. Next. Visceral pain. Pain from viscera is very unpleasant. It is poorly localized. Next. So causes of visceral pain. First, ischemia substances released during ischemic reactions such as bradykinin and proteolytic enzymes stimulate the pain receptors of viscera. Second would be chemical stimuli. Substances like acidic gastric juice leak from ruptured ulcers into peritoneal cavity and produce pain. Third, spasm and overdistension of hollow organs, spastic contraction of smooth muscles in gastrointestinal tract, and other hollow organs of viscera cause pain by stimulating the free nerve endings. Next, referred pain. It is the pain that is perceived at a site adjacent to or away from the site of origin. Deep pain and some visceral pain are referred to other areas, but superficial pain is not referred. Next. Examples of referred pain. Cardiac pain is felt at inner part of left arm and left shoulder. Pain in ovary is referred to umbilicus. Pain from testis is felt in abdomen. Pain in diaphragm is referred to shoulder. Pain in gallbladder is referred to epigastric region. Renal pain is referred to loin. Next. As you can see in the image, the examples of referred pain. Next. So mechanism of referred pain. According to dermatomal rule, pain is referred to a structure which is developed from the same dermatome from which the pain-producing structure is developed. Sites of referred pain. A dermatome includes all the structures or the parts of the body which are innervated by afferent nerve fibers of one dorsal root. For example, the heart and inner aspect of left arm originate from the same dermatome. So, the pain in heart is referred to the left arm. Next. As you can see in this image. Next. Analgesia system. So this system means the pain control system. Body has its own analgesia system in brain, which provides a short-term relief from pain. It is also called endogenous analgesic system. Analgesia system has got its own pathway through which it blocks the synaptic transmission of pain sensation in spinal cord and thus attenuates the experience of pain. In fact, analgesic drugs such as opioids act through this system and provide a controlled pain relief. Next. Analgesic pathway that interferes with pain transmission is often considered as descending pain pathway, the ascending pain pathway being the afferent fibers that transmit pain sensation to the brain. Next. So, this is the analgesic pathway. Next. As you can see in this image. Next. Now, gate control theory. Pain pathway and analgesic pathway located at the posterior gray horn of spinal cord. If the gate is opened, pain is felt, and if the gate is closed, pain is suppressed. Next. Now, mechanism of gate control at spinal level. When pain stimulus is applied on any part of body besides pain receptors, the receptors of other sensations such as touch are also stimulated. When all these impulses reach the spinal cord through posterior nerve root, the fibers of touch sensation send collaterals to the neurons of pain pathway, that is, cell of marginal nucleus and substantia gelatinosa. Impulses of touch sensation passing through these collaterals inhibit the release of glutamate and substance P from the pain fibers. This closes the gate and the pain transmission is blocked. Next. Role of brain in gate control mechanism. If the gates in spinal cord are not closed, pain signals reach thalamus through lateral spinothalamic tract. And these signals are processed in thalamus and sent to sensory cortex. Next. Perception of pain occurs in cortical level in context of the person's emotional status and previous experiences. So the person responds to the pain based on the integration of all this information in the brain. Thus, the brain determines the severity and extent of pain. To minimize the severity and extent of pain, brain sends message back to spinal cord to close the gate by releasing pain relievers such as opiate peptides. Now, the pain stimulus is blocked and the person feels less pain. Next. Significance of this mechanism. Gating of pain at spinal level is similar to presynaptic inhibition. It forms the basis for relief of pain through rubbing, massage techniques, application of ice packs, acupuncture, and electrical analgesia. All these techniques relieve pain by stimulating the release of endogenous pain relievers, that is opioid peptides, which close the gate and block the pain signals. Next. As you can see in this image. Thank you. Thank you so much.
Thank you, Dr. Nikita,
Yes, sir.
for the wonderful presentation related to pain physiology. Next is a poster presentation.
Yes, sir. Poster also.
Please start the session, doctor.
Okay, sir. So once again, good evening, everyone. My poster topic name is Management of Amlapitta with Samanya Vishesh Siddhanta. Okay, so Ayurveda is holistic science which treasures the knowledge of each detail to live a healthy, wealthy, and happy life. Samanya Vishesh Siddhant is the basic and most common principle for treatment of any disease in Ayurveda. Samanya means uniformity, and Vishesh denotes the non-uniformity. Every disease occurs due to disturbance in state of equilibrium, state of bodies, dosh, dhatu, or mal, that is either increase or decrease in their state. Amlapitta, which we correlate with the hyperacidity, occurs due to derangement of Agni, thus altering the normalcy of Pitta dosh. Due to alterations in food and lifestyle, many people are falling prey to digestive disorders. Condition of Amlapitta is one of them. So now we'll see how Samanya Vishesh Siddhant can treat Amlapitta. So now, Samanya leads reconstruction in Dravya, Guna and Karma. So following components should be avoided as it would increase the quantity or quality of Dravya, Guna and Karma. So now, Dravya Samanya like kulatha, boiled grains, drinking over the top water, recently made liquor, matured items like curd, idli, dosa, dhokla and so on, as you can see in the image. Now, Guna Samanya, utilization of Ushna, that is hot strength and Drava Gunatmak food item, Amla Padartha like sour and stuff, this all expands the Pitta dosh. And Karma Samanya like Ushapan, Divaswap, exorbitant fasting, concealment of normal urges, that is vague dharan, eating at an ill-advised time when past isn't as expected. So now all these conditions are of examples of Samanya. Now, we'll see the Samprapti. We'll see the Samprapti breakdown by Samanya Vishesh Siddhant. So now, Nidan Sevan, it is the Nidan Parivarjan of. So first we'll see the Samprapti, Nidan Sevan. In that Aharaj, Viharaj, Mansik and Agantuj Hetu, which vitiates the Pitta Pradhan Tridosh Prakop, it increases in Amla. It increases in Amla and Trava form, which leads to Agni Mandya, and the Vidagda Pak of Ahar leads to Ama and Shuktata, which leads to Amlapitta. So now here, Nidan Parivarjan of Samanya we have to do. For Agni Mandya, there is Guna Vishesh, Vidagda Pak of Ahar, Dravya and Guna Vishesh, and Am and Shuktata, Dravya, Guna and Karma Vishesh. Now we'll see how the Vishesh works. Vishesh leads to destruction in Dravya, Guna and Karma. So the following components should be included as it would decrease the quality or quantity or quality of Dravya, Guna, Karma. Dravya Vishesh, I have taken here the drug Amalki. It works on principle of Prabhav as well as Shita Virya and Madhura Vipak helps to reduce the vitiated Pitta. Guna Vishesh, Shunthi. It is Grahi. It will reduce the Drava Guna of Pitta and Shita Virya will not increase Vidagdata, and due to its deepened property, it will help in Agnimandya. Next is Karma Vishesh. Shodhan Upakram like Vaman and Virechan depending upon the bala of patient, as you can see here in the images. So now, I conclude my poster by saying that Siddhantas are the root of Ayurveda. Among this, Samanya Vishesha Siddhant have its special space in context of treatment of diseases. This principle of Charak is applicable to achieve physical, mental, and spiritual well-being. By this principle, a medicine used properly will regain the equilibrium state of doshas and dhatus, which were previously dushit and were causing imbalance. Thus, application of this principle proves to be more effective way of treatment, including food activities, medicines, and lifestyle modifications. Thank you so much.
Thank you, Dr. Nikita. Thank you for the wonderful presentation.
Thank you,
so
sir.
much, Doctor.
Thank you.
Next is a paper presentation. I'd like to invite Dr. Ranjit Shankar Sajagane for the paper presentation. Dr. Ranjit Shankar, are you there? Dr. Ranjit Shankar, are you there, Doctor? Ranjit, please unmute, doctor. Next is a poster presentation. I would like to invite Dr. Krupa Pravinbhai Patel for the poster presentation.
Good evening to all. Myself, Dr. Krupa Patel from Kaichikisa Department, second year MD scholar. Today's my topic is the management of the anxiety disorder and Ayurvedic approach. Abstract. Anxiety is a physiological emotion which is arose when there is a imminent threat. It also causes hypervigilance toward the perceived source of threat, which prepare a person to take the action to fight that particular threat or neutralize it. Activation of the hypothalamic pituitary adrenal axis and sympathetic hyperactivity manifest in physical symptoms such as the palpitation, sweating, tremors, dryness of the mouth, breathlessness, and abdominal discomfort. Anxiety symptoms look like feeling fears, uneasiness, problem in sleeping, cold and sweating hand and feet, shortness of the breath, restlessness, obsessed with the recurrent thoughts, inability to still and calm. Patient description: a 33-year-old male patient from Vadodara approached Manas OPD at Parul Ayurvedic Hospital on 18 May 2024 with the complaints of the severe palpitation, reduced interest in activity, weight gain for 12 years on medications such as antipsychotic, sedative for 8 years. Patient history: a 33 years old patient was working in Kenya during 2010. Episodic discomfort of the severe sweating, palpitation. Came back to India. Another episode during the marriage function. Psychiatric prescription, antipsychotic and antidepressive and sedative was taken. Patient was went to Manas OPD in PH during May 18, 2024. Examination of the patient, systemic examination. First one is a cardiovascular examination. S1, S2 is a normal, no any murmur sound was found. Then after CNS examination, patient well oriented with the time place person. Then after respiratory examination also normal. Bilateral air entry normal, no any added sound, no any congestion, bilateral vocal resonance symmetrical, bilateral chest movement normal, trachea was centrally placed. Then after GIT examination also normal. Per abdomen soft, no any organomegaly found, normal bowel sound, no any tenderness. Then after neurological examination, in neurological examination, mental status was normal, cranial nerve intact, motor function normal, sensory function normal, also reflex is normal. Psychosomatic psychomotor examination was done with the Hamilton Anxiety Rating Scale. In the patient, Hamilton Anxiety Rating Scale is a 24 or 25. Also, consciousness of the patient is the conscious, general appearance, tense and nervous, mood of the patient is irritative. Treatment protocol. First one is the coast sojourn. 3 days of the coast version was given with the 30 ml Erandadi plus 50 ml milk. After then, 10 days of Abhyang was done. Abhyang done with the Balashwagandha oil. After that, Sirodhara also 10 days given. Sirodhara with the Mashyadi Kasai was given. After then, 8 days Yog Basti. In Yog Basti, Anuvasan Basti was given with the Balashwagandha tel and Niru Basti was given with the Eral Muladi Niru Basti. After then, 10 days, Nashya was given. Nashya in Pratimash Nasya with the Bala Ashwagandha oil. outcome of the patient. During the treatment, the dose of the medicine will taper and stop completely at the end of the treatment. Through proper counseling and psychotherapy, this fever and worries has been overcome. Hamilton anxiety rating scale at the end of the treatment improved from 25 to 4. Discussion. By through examination, a cause behind the condition was found as fever and worry. Treatment protocol adopted was focused on cause such as a bhai, chinta, shok, which is a cause by the vitiation of the vat dosa, rajo, and tamas gun. Simultaneously, application of the Sodhan and Saman Karma was given along with the counseling to overcome the fear with the use of the Medhya Rasayan. Thank you.
Thank you, Dr. Krupa Patel, for the well-explained poster presentation. Next is also a poster presentation. I would like to invite Dr. Anany Trivedi for the poster presentation. Just a moment, doctor. I will share the screen.
Good evening to all. Myself, Dr. Anany Trivedi, second year PG scholar, Department of Kaya Chikitsa, Parul Institute of Ayurveda, Vadodara, Gujarat. Today here I am presenting a poster of Ayurvedic insights into pre-diabetes, healing and prevention. This is a topic for my today's presentation. So we first start with pre-diabetes. So basically, diabetes is spreading throughout the globe rapidly. At present, worldwide population of around 387 million is diabetic and predicted to reach 592 million by 2035. India ranked first in the world with the highest number of people with diabetes mellitus, followed by China. At present, no absolute treatment modalities are available to stop the progression of diabetes and to prevent the development of its deadly complications. A practical way to deal with diabetes could therefore be its prevention by avoiding the risk factor and by stopping the disease pathology in earlier stage. And the earlier stage is the pre-diabetic stage. So what is pre-diabetes? Pre-diabetes represent an elevation of plasma glucose level above the normal range but below that of clinical diabetes. Every individual passes through a phase of pre-diabetes before developing diabetes. So here in poster, we mention the range of pre-diabetes and then diabetes also. Pre-diabetes is condition of glycemic dysregulation mainly due to sedentary lifestyle, which results in obesity and other metabolic disorders in mostly India-like countries. So early detection and prevention of pre-diabetes need to delay the diabetes and other conditions. Indian Diabetes Prevention Program show 18% among the subjects with impaired glucose tolerance level. there are 77.2 million people in India who are suffering from pre-diabetes currently, with a prevalence rate of 10 to 15%, and almost 18% people every year convert from pre-diabetes to diabetes. So it is a major role to stop that condition to convert into diabetes. We start with Ayurveda here. So if we go through a literature of Prame, all Acharya describe Prame Purvarup in details. Here I mention all 11 Prame Purvarup given by Acharya Charak, like Hastapad Tal Da. We frequently seen burning in palms and soles of the patients, etc. Now, diabetes is a vivid described in Ayurveda, and it's a full spectrum from etiology to preclinical to clinical features and complications, along with stage-wise management. The preclinical description of Prame or Madhume is described in our classical texts. While looking at various features claimed to be there, preclinical diabetes features spread across the various Ayurveda classics, we find that pre-diabetic features are actually extended proximally and continue to show up even when the diabetes is fully present clinically. Now we are looking for a modern aspect with Ayurveda. So looking carefully at the pre-diabetic features described in Ayurveda, like for example, we took excessive growth of nails and hairs, Nakha Vruddhi and Kesa Vruddhi, clearly defines affinity of glucose to nail and hair, leading to their excessive growth. Glycation of nail proteins is one of the fine example of diabetic glycation related target organ damage. Then other features like here is a Ghana Angata, like overnourished body parts, are the cutaneous manifestation of diabetes, which may often be reported at the first sign of diabetes or may develop at the time of course of the disease. Then skin thickening, etc. Features also seen. A sweet taste of mouth, Asya Madhurta, has also been proposed as a pre-diabetic feature in Ayurveda. Alteration in taste have previously been proposed as a pre-diabetic feature, with reduction in sweet taste as a precursor of increased liking of sweets. So here are the concept of pre-diabetes and Prameya Purvaru. Now, concept of Sat Kriya Kal is also important here. Ayurvedic pathogenesis pursues 6 stages known as a Sat Kriya Kal. So it gives us 6 opportunity to stop the disease. Among these 6 stages, Vyakta represents the disease stage. So clear clinical features. So before that, all the stages, like the stage of Sthan Sansraya, actually sets the stage for clinical manifestation of the disease. In this process itself starts reflecting through prodromal features. So from Sanchar till the stage of Sthan Sansraya, these are the stage where we have to find the patients of with a Prameya Purvarup, and we can stop the disease to finally convert them into Prameya. So Sanchay to Sthan Sansray are the main stages of Kriyakal to focus. In Chikitsa, so basically Prameya is a Bahudos Avastha, and Acharya Charak mentioned that Bahudose Sodhanam Hitam. So Sodhan is a must, the choice of the treatment in the patient having a Prameya or a Prameya Purvarup, because in Prameya cough and Pitta those are found as a dominant factor, and we can give Vaman and Virechan, which are the best Sodhan therapy to eliminate cough and Pitta dose respectively. By the elimination of cough and Pitta, the obstruction, I mean avran created by the bath will also be removed. The elimination of cough and pitta will reduce the cough and pitta vargiya dusya also. So in this way, Virechan and Vaman therapy reduce the dose and dusya. And then after that, Saman Chikitsa also play their important roles. So here is my presentation regarding pre-diabetes, Prameya Purvarup, its a correlation, and some brief line of treatment regarding it. Thank you. Thank you all.
Thank you, Dr. Anany Trivedi. Thank you for the presentation. Next, I would like to invite Dr. Satpude Chetan Mahadev for the paper presentation. Dr. Satpude
Yes, sir.
Chetan, are you there?
Yes, sir.
Good evening, doctor.
Good evening, sir.
Doctor, please start the session.
Yes, sir. Good evening, sir. Good evening, everyone. Myself, Dr. Chetan Mahadev Satpute, LKR Ayurvedic College, Gadinglaj, Maharashtra. Paper presentation. My topic name is an observational comparative study of uric acid level in clinically diagnosed cases of Uttan Vatarakta and Gambhir Vatarakta. Next, sir. The health of an individual depends solely on his her diet and lifestyle. As a result of rapid modernization, consumption of fast food, unhealthy and sedentary life, alcohol, smoking, irregular sleeping pattern, and stress are contributing number of diseases which have become challenges for the human race. The causative factor of Vatarakta mentioned in Charak Samhita are closely related to faulty eating habits and sedentary lifestyle. Prakupita, Vata, and Rakta are vitiated with separate etiology factor and obstruct into the Parvasandhi, and symptoms start as Parvasandhi Shul, Daha, and Shul in Parvasandhi. Next, sir. Next. According to Acharya Charaka, there are two types of Vatrakta, Uttan and Gambhir. In Uttan Vatrakta, Toka and mouse involved in the Gambhir, and Gambhir Vatrakta, Meda, Asti, Majja, Toka, and mouse involved. Kandu, Daha, Spurana, Toda, etc. were Lakshanas seen in Uttan and Gambhir Vata. Next. Need for study. According to Acharya Susruta, Vatrakta has two avastha, and according to Acharya Charka, Vatrakta has two types, Uttan and Gambhir Vatrakta. Most of the cases Vatrakta are related to the food drugs infection. Until biomechanism of this disease is known, treating this disease remains a challenge. So there is a need of differentiate laboratorically the pathogenesis of the disease. So there is a need to study disease and the laboratory evaluation of serum uric acid level values. Next, sir. Primary objective to compare the value of serum uric acid level in Uttan and Gambhir Vatrakta. Other objective to study etiological factor of Vatarakta from Samhita and modern text and articles, to study of the change value serum uric acid level in Uttan and Gambhir Vatarakta. Next, sir. Methodology. Observational study. Selection of patient. 60 Uttan and Gambhir Vatarakta patients are selected. Patients were selected OPD and IPD basis. Only Uttan and Gambhir Vatarakta clinically diagnosed patients were selected. Next. Inclusive criteria. Patients showing the sign and symptoms of Vatarakta like Sandhishul, Sandhishot, Taha, and Sandhisupti. Patients between 20 and 60 years of age. Patient will selected irrespective of religion, sex, and socio-economic status. Exclusion criteria. Amvata, SLE, rheumatic RA, etc. Sandhigat Vata, osteoarthritis, pregnancy, and other illness like diabetes mellitus, tuberculosis, leprosy, HIV, HBCs. Next, sir. Criteria for withdrawal. Patient who will discontinue the treatment, patient show any type of adverse effect, if any complication occur. Investigation serum uric acid level. Next, sir. Criteria for assessment, subjective parameter, joint score, Sandhi Supti, mentioned below. Next, sir. Sandhi Shul by PAS scale, Daha, burning sensation. Next, sir. Objective parameter, Parshasahत्व, tenderness, Sandhi swelling, mentioned below. Next, sir. Local temperature of affected joints, functional score. Next, sir. Serum uric acid level. Next, sir. Observation and result. Observation and result were drawn from the data which is collected during the study. Observation were done according to age, gender, etc. demographic data and also according to the assessment criteria. Result were drawn according to serum uric acid level in the Uttan and Gambhir Vatarakta. Next, sir. Conclusion. Vatarakta is one of the important diseases which is spread through the eating habits and sedentary lifestyles. Various complications were occurred after Vatarakta. According to Ayurveda, they were included in Sandhigatwadi. In this observational study, Vatarakta disease were related with the Astivas and Protodrishti Lakshanas. This study were helps to prevent complication of Vatarakta. Thank you. Thank you, sir.
Thank you, Dr. Chetan Sathya, for the wonderful presentation. Next, I would like to invite Dr. Uddhav Baburao Chaugale for the paper presentation. Dr. Uddhav Chaugale, are you there?
Yes, sir, I am here.
Good evening, doctor.
Good evening, sir. Good evening, everybody. Please share, sir, my PPT.
So, doctor, just a moment, I'll share for you. Start the session, doctor.
Sir, this is PDF. Can you share my PPT?
Okay, just a moment, doctor. Doctor, can you send the PPT once again to my WhatsApp, doctor?
Okay, no problem. I will send just a second.
Please start the session, doctor.
Okay. Thank you, sir. Good evening, everybody. Okay. Sir. Hello, myself Dr. Uddhav Baburao Chogle from LKRS Medical College, Kolhapur, Gadhimlas. Today I presenting my topic. Topic title name is to evaluate the efficacy of Jatadi Telpichu and Likujadi Telpichu in the management of pericarditica with special reference to acute fissure in anos. Next, sir. Introduction. Parikartika was shortly explained by Acharyas. Acharya Charaka, Chakrapani and Vagbhat used the two words, Vikartika as well as Parikartika for this condition. Acharya Dalana has characterized the term Parikartika as a cutting or tearing pain at Guda region. Acharya Kashyap described three types of Parikartika, Vataj, Pittaj, Kaphaj in Garvinis. Parikartika is a disease characterized by तीव्रशूल दाह विबंध सपिच्च स्त्राव रुजा अरुचि. According to modern science, fissure in ano is described as a constipation hard stool while passes through the anal canal in patient where there is a spasm of internal sphincter and hypertrophied anal papilla and acute tear of the anal canal will occur. This fissure will cause spasm, pain and defecation and passage of bright streaks of blood along with the stool or will be seen in the tissue paper. Next, sir. Next. Need for study. Surgical procedures like large dilation, sphincterectomy, hysterectomy, but they have complications like incontinence, stenosis, and stricture formation. In posterior sphincterectomy, disadvantage is a prolonged convalescence periods of 7 to 10 days, and in occasional cases, there may be persistent mucus discharge. Because of this complication and no known satisfactory medication involved in the management of fissure in ano has provided scope for adapting. Next. Primary research question. If there is any significant difference between the efficacy of Jatadi Telpichu and Likujadi Telpichu as a local application in the management of pericarditica? Primary hypothesis. Null hypothesis. There is no any significant difference between efficacy of Jatadi Telpichu and Likujadi Telpichu as a local application in the management of pericarditica. Alternate hypothesis. There is significant difference between efficacy of Jatadi Telpichu and Likuchadi Telpichu as a local application in the management of pericarditica. Next. Review of literature. Pericarditica is explained in Susrut Chikitsa 34 16 number slow. Next, sir. There is another one definition is according to Charaka, Tivra Shula Picha Strava Karoti Parikartikam. According to Charaka, Parikartika is characterized with severe pain, slimy discharge with blood. Next, sir. Drug review, Likuchaditel. This formulation is explained in the context of Bharat Bhaishya Ratnakar volume 4 having properties of Vranashrodhana and Vranaropana. Next. Likuchaditel contains are Likuch, Haridra, Tila. Next. Gomutra, Sandava, Gugula. Next, sir. And Sarja. Next. Another drug is Jatadi Tela. This formulation is explained in the Sharangar Samhita, Madhyam Khanda. This formulation is ideally Vranashodhaka, Vranaropaka, and Rakta Prasadaka. Next, sir. Drugs are Jati, Nimba, Patola. Next. Kutki, Daru Harida, Haridra. Next. Sariva, Manjishta, Haritaki. Next. Sikta, Tutta, Madhuka. Next, Kushta, Padma Kashta, Lodra. Next, Kamal Tila, Karanj Bija. Next, okay, sir. Primary objective to compare the efficacy of Jatyadi Tel Pichu and Likujadi Tel Pichu in the management of Parikartika. Other objective to study the efficacy of Jatyadi Tel Pichu in the management of Parikartika, and other objective second to study the efficacy of Likujadi Tel Pichu in the management of Parikartika. Next, methodology. Here, type of study design is a comparative clinical trial. Location of study in house hospital. Duration of study will be carried out within 18-month duration. Duration of treatment 21 days. Next, sir. Now I am showing study flow diagram. Collection of raw material, then authentication of raw materials, preparation of Jatyadi Tel and Likujadi Tel, standardization of Jatyadi Tel and Likujadi Tel, then selection of patient criteria, inclusive criteria, exclusive criteria. In inclusive criteria, we create two groups, Group A and Group B. Group A will provide Jatyadi Tel Pichu local application twice a day, and Group B, Likujadi Tel Pichu local application twice a day. And follow-up will be done on first 7th, 14th, and 21 day. Data collection and statistical evaluation and conclusion will be done. Okay. Next slide. Inclusive criteria. Patient of age 18 years to 16 years suffering from only fissure in ano, acute fissure in ano. The cases will be randomly selected irrespective of sex, chronicity, dosha, and types of fissure. Exclusive criteria. Patient below 18 years and above 16 years of age, known suspected case of malignancy of anus or rectum, multiple fissures in ano as a complication of skin disease, known case of sexually transmitted disease, HIV infections and other infections disease, fissure secondary to fistula in ano, ulcerative colitis, tuberculosis, syphilis, Crohn's disease, other systemic disease pertaining to colorectal, etc. Uncontrolled diabetes mellitus, tuberculosis of rectum, pregnancy, fissure more than 2. Next. Procedure for drug administration. Patients in group A, there is 30 patient. Group B, there is 30 patient. Drug A group Jatyadi Tel Pichu, drug B Likujadi Tel Pichu. Duration 21 days. Route external application. Time morning and evening after defecation. Next, sir. Common intervention for both the groups. Trifura Churna orally 1 to 2 teaspoon at bedtime daily. Lukewarm water 6 bars twice a day. Method of application. Keep patient in left lateral position. Tell patient to strain before insertion of pichu. Then apply pichu deep in Likujadi or Jatyadi tel at tela at fissure site in anal canal with supportive sitz bath BD. Next, sir. Criteria for assessment. There is subjective assessment and descriptive assessment. Next, sir. We for criteria assessment we making for 3 grades, grade 0, grade 1, grade 2, grade 3. According to pain, burning sensation and bleeding, there is gradation. If there is no pain, grade 0, no burning sensation, no bleeding, then grade 0. If there is 15 to 20 minutes pain after defecation, 15 to 20 minutes burning sensation after defecation, and occasionally wetting the garment, slight bleeding, then there is a grade 1. Grade 2, if there is a 30 to 60 minutes pain persisting after defecation, 30 to 60 minutes burning sensation after defecation, wetting the undergarment, moderate bleeding, then there is second grade. And in third grade, pain, ruja is continuous pain, burning sensation, continuous burning sensation, heavy bleeding which needs pad. Okay, sir. Next. Objective assessment will be sphincter will be check sphincter spasm, number of speeches, symptoms, tenderness. If grade 0, then there is no tenderness, no sphincteric spasm. In grade 1, mild tenderness, allow to PR states mild pain. Grade 2, moderate tenderness, sphincteric spasm, allow to PR with moderate pain. And in grade 3, severe tenderness, not allow to PR. Investigation, if required, there is CBC with ESR. Next, sir. Yes. Next, sir. Next. Okay. At last, observation and results. For the assessment of the total effect of therapy, following 4 categories will be taken into consideration. If there is a patient fully recovered, then there is a grade 0, 76 to 100% complete relief in subjective signs and symptoms, grade 0. Marked improvement, there is a 51 to 75% moderately relief in subjective signs and symptoms, grade 1. Moderately improvement, 26 to 50% relief in signs and symptoms without any change in size and numbers. It is grade 2, and unchanged below 25% no signs and symptoms are relief, grade 3. Okay, there is last there is this is a result according to conclusion. Thank you, sir.
Thank you, Dr. Uddhav Chogule. Thank you for the detailed explanation.
Okay.
Explanation.
Okay, thank you,
Next,
sir.
I would like to invite Dr. Venkatesh Jagannath Karat for the presentation. Dr. Venkatesh, are you there?
Yes, sir. Good evening, sir.
Good evening, doctor. It's a poster presentation.
Sir, can you share my file, sir?
Sure, doctor. Just a moment. I will share it for you. Dr. Venkatesh, please start the session, doctor. Dr. Venkatesh, please start the session, doctor.
Sorry, sir. I'm not. The screen is not visible to me. Okay, okay. Good evening, all of you. My name is Dr. Venkatesh Karada. I am second year PG scholar, Department of Sahita, CSMSS Ayurved Mahavidyalay, Kanchanwadi, Chhatrapati Sambhajinagar, Maharashtra. I am presenting a poster today. My topic is understanding disease formation through the lens of Manasik etiology and Ayurvedic perspective. Next slide, please, sir. Next, sir. Sir, I think there is a network issue. I will present it directly, sir. If you have no problem.
Okay, doctor.
According to the Ayurveda classics, mana is considered one of the main etiological factors in the development of various diseases, including those affecting the Agni, Srotas, Dhatu, and other bodily systems. The Sahitas highlights the importance of man in understanding the pathogenesis of various diseases, including Mahagat, that is chronic diseases such as Vatvadi, Kushta, and Udar. It also mentions that Mansik Hetu plays a role in development of Jarvadi and other diseases. The text also preference to the concept of Sattva Vajay Chikitsa which suggests that the treatment should not only focus on physical aspects, but also on mental and emotional well-being. Overall, the text emphasizes the importance of understanding the role of mana in Ayurvedic medicine and its application in the diagnosis and treatment of various diseases. As you know, according to the WHO, the health is defined as a state of complete physical, mental, social, and spiritual well-being, and not merely an absence of illness or infirmity. As Sushruta has explained, given the definition of swastha, samadosha ha samagni samadhatu malakriya prasanna atmendriya mana swastha iti abhiryate. The Sushruta has given importance also to the physical as well as prasanna atma mandriya and man. Ayurvedic sciences recognizes the importance of mental elements in maintaining the well-being and acknowledges the concept of mana, which is substance responsible of belief and thought. According to Ayurveda, the concept of mana refers to the mental aspect of an individual's being, which is responsible for their thoughts, emotions, and behavior. The idea of mana is recognized as key factor in maintaining overall well-being, as imbalances in the mental state can lead to various physical and psychological problems. The Ayurvedic text Sutrasthan describes different types of mental states, including Kama, Krodha, Bhaya, Shok, and Chinta, which can cause imbalances in the three doshas, Vata, Pitta, and Kapha, and lead to diseases such as Unmat and various diseases. These mental states can also affect an individual's ability to make rational decisions, leading to Prajnapraj. The history of Mansik Vikara dates back to the Vedic period and is still prevalent today. As you know, it is very increasing day by day in today's lifestyle. Next slide, sir. Next slide, sir. Slide number 4, sir. 4. Charka and Sushruta, but all agree that the site of man is Hriday, and according to Bhel Samhita, the site of man is Shira and Tal, between Shira and Talvendriya. Relation to three dosha. The body and brain are interrelated and interconnected, and the three doshas, Vata, Pitta, Kapha, influence mental processes. Vata is considered the primary dosha that affects mental activities, serving as a regulator, inspiration, and controller of all mental movements. Mansik Bhava as Hetu. According to Acharya Charka, Stotoviman Adhyay mentions Mansik Hetu as the cause of disease. The different stotas are associated with specific emotions such as Bhaya, Atichinta, and Krodha. The Samprapti, next slide, sir. Sir, next slide. According to the various acharyas, and the Samprapti is when you save Mansik Hetu 7 is happened, the Manas Dosh Dushti is happened, and due to Sharir Dosh Dushti has happened, it causes Agnimanda. And as Vagbhata said, Rogaha Sarva Mandagno, it's Agnimanda causes various diseases and various Vyadhi Utpattis are happened. Next slide, sir. In Charak Vimanstan, Trivid Kukshi, sorry, so Stotaviman Adhyay, the Charkacharya has described the various Dushti Hetus of Strotas Dushti. In Udakva Strotas, the Charak states that Oshnat Amad Bhayat, Panat Ati Shushkanna Sevanat, Ambuvahini Dushtanti, Tushna Yacha Ati Prenat. Here it is stated that the Bhaya Hetu causes Dushti of Udakva Strotas. In Rasava Strotas Dushti, Charkacharya stated that Guru Shitam Ati Snigdam, Ati Matram Samashnatam, Rasavahini Dushyanti, Chintyanamcha Ati Chintanat. Here it is stated that the Ati Chinta can cause Rasava Strotas Dushti. And in Svedava Strotas, it is stated that Vayamat Ati Santapat, Shitoshna Krama Sevanat, Shedavahini Dushyanti, Krodha Shoka Bhayastata. Here Krodha Shok and Bhaya causes Svedava Strotas Dushti. And as you know, when Strotas Dushti happens, the imbalance of dosas has happened and various Vyadhis are created. Next slide, sir. Here, the review mentions astomahagata, which refers to significant problems that can result in basic and lethal condition. The different diseases associated with Mahagata and their Mansik Hetu are one number, that is Vatvedi, and the Mansik Hetu is stated as Ati Santap, Chinta, Shoka, Dukha. This is stated in Acharka and Sushruta. Second number, Kushta, Mansik Hetu, Ati Santap, Bhaya. It is stated by Charka. The third Vyadi is Udar, Mansik Hetu are Papa Karma, Pradyaprat, and it is stated by Acharya Charka. The fourth Vyadi is Apasmar, and its Mansik Hetus are Bhaya, Tras, Shok, and it is stated by Charka. The fifth Vyadi is Raja Yakshma, and its Hetus are Krodha and Dukha. It is stated by Charka. So this was my presentation. Thank you, sir. Thank you, all of you.
Thank you, doctor. Thank you for the presentation. Next, I'd like to invite Dr. Vineet Vijay Rajpure for the paper presentation. Dr. Vineet, are you there? Dr. Vineet Vijay, are you there? Dr. Vineet, are you there? Okay, next we go to the paper presentation. The topic of paper presentation is Ayurvedic management of Krimi Granthi with the help of Haridra Kwath Seka. I would like to invite Dr. Jude Aslam Kothali for the paper presentation. Dr. Jude, please start the session, doctor.
Hello, good evening everyone. My name is Dr. Aslam Kothali, PG scholar from Yeshwant Ayurved College, Kolhapur. My today's presentation topic is Ayurvedic management of Krimi Granthi with the help of Haridra Kwath Seka. Blepharitis. Apange va kanine va kandama potavana puyastravi Krimi Granthi krutiyoto dhartimana. According to Vagbhat, it is painful condition caused by infection and is associated with the development of tumors in the canthus area, itching, burning, sensation, falling eyelashes. Introduction. Blepharitis is subacute or chronic inflammation of the lid margin. It is extremely common disease. Chronic blepharitis is common cause of the ocular discomfort and irritation. Involvement is usually bilateral and symmetrical. Blepharitis may be subdivided into anterior and posterior, although there is often considerable overlap in the symptoms. Blepharitis affects the area surrounding bases of lashes. Etiology. Predisposing factor. Poor hygiene condition, external irritants like dust, severe eye strain, overuse of cosmetics, patient with seborrheic as well as blepharoconjunctivitis. Causative organism is Staphylococcus infection. Signs and symptoms. Burning sensation, itching, irritation, grittiness, photophobia, redness of lid margin and conjunctival hyperemia, watering, crusting, redness and dry eyes, madrosis, oil tear films. Aim. To study the role of Haridra Kwath Seka in blepharitis management. Methods and material. Review regarding blepharitis and Klinavatma was done from Ayurvedic and modern textbooks, journal and internet sources. Collected data compiled and classified as mentioned in text. Haridra. Latin name Curcuma longa, local name Haldi or Halal. family Gingiberraceae, guna लघु वृक्ष, रस तिक्त मधुर, विपाक कटु, वीर्य उष्ण. Seka Vidhi, Seka. The etymology of Sek is or watering. Seka is one of the procedure performed for eyes. Netra Seka is a procedure where medicated liquids or oils are poured on the closed eyes from the height of 4 angula, means 4 inches in the and cream for prescribed time, which is helpful in initial stages of netra rogas where dosha is less. Seka Kala. According to dosha, Vata dosha, Snehana Seka is given for 600 matra kala. For Rakta and Pitta dosha, Ropana Seka is given for 400 matra kals. In disorders of Kapha roga, Lekhana Seka is given for 300 matra kala. Or Sechana. Indication of Seka. If redness, too much lacrimation, irritation, pain, burning sensation, pricking and tearing pains, ulceration, swelling and indications of Seka are in Purvarupa stage of Netraroga. So Seka is advised in prodominal stage of Netra Vikara. Importance of Seka. It is Bahirparimarjan Chikitsa done in Amavastha of Netraroga for Pachan of dosha. The dosha gets subdivided by Seka, which is similar to the fire extinguished by water. Procedure of Haridra Seka. First, the Pachan drugs are given in prior to treatment. Acharya Dallana has mentioned Lagu Bhojana Ahar given prior to Seka. Seka medicine is prepared, then a person is made to lie down, face and eyes are cleaned with the cotton dipped in warm water. Haridra Kwath is poured on eyes from height of 4 angula, cleaning of eyes with soft cotton cloth and rest the eyes. Mode of action is it is the virya, karma and prabhav of drug which is acts when comes in the contact with the skin of eyelids, netra sandhi and sira of netra. By those quality of drug, Pachana and Shamana of Netra Gata dosha can be attained. Principally, corneal epithelium, which is lipophilic, and stroma of hydraulic, when poured in thin stream, provides more drug delivery to cornea and also reduces the surface tension. It is performed on closed eyes. Absorption is done through the conjunctiva. Also occurs when the drug is hydrophilic. The corneal layer, that is stroma, allows rapid passage of drug through endothelial into anterior chamber. So it is advised in all inflammatory diseases of eyes. Haridra is Kandugna, Shothagna, Chakshusha, Vedna Sthapana, Tridoshahara and Kafagna. So these properties reduces signs and symptoms of the blepharitis. Discussion. Clinical studies exploring the efficacy of Haridra Kwath Seka in Krimi Granthi management are reviewed, highlighting its potential to alleviate symptoms such as the redness, itching and swelling. Furthermore, the holistic approach of Ayurveda in addressing individual constitution means Prakriti and potential root cause of Krimi Granthi is underlined. Possible mechanism of action including inhibition of the pro-inflammatory cytokines and modulation of the immune response are hypothesized based on the existing research on Haridra. Conclusion. Blepharitis is common lead margin disorder which caused by overuse of the cosmetics, unhygienic condition and secondary to staphylococcal and parasitic agents. Application of Haridra Kwath Seka with maintenance of the hygiene relieves various symptoms of blepharitis, that is burning sensation, itching, photophobia, redness and watering. Haridra has Chakshusha, Vedna Sthapana, Shothagna, Kandugna properties which reduces signs and symptoms of the blepharitis. To study conclude that by using Ayurvedic drug we can overcome blepharitis. Thank you.
Thank you, doctor. Next, I would like to invite Dr. Saujanya J for the paper presentation. Dr.
Good
Saujanya,
evening.
are you there?
Yeah, am I audible?
Yes, doctor, audible. Good evening, doctor.
Yes, I'll be sharing the screen.
Sure, doctor. The screen is visible, doctor.
Is it visible, sir?
Yes, doctor, visible. Please tell the question, doctor.
Hello.
The screen is visible, doctor. Please start
Yeah,
the session,
okay.
doctor.
Hi. Good evening, all. Today I'll be presenting a topic on an analytical review on Sandhigata Vata, a case study. So, moving into what is Sandhigata Vata, vitiated Vata affecting skeletal system joints is considered as Sandhigata Vata, where it is considered as Vata Purna Dhrutisparshaha, Shotaha Sandhigate Anile, Prasarana Akunchanayoho, Pravrittischa Savedanaha. So, here what happens? Mainly the Prakupita Vata does Sthana Samshaya to Sandhi, swelling on palpation, person feels as it is filled with vata, affected person experiences pain on various movements of joint. This is majorly all of our physicians will be having this, visualizing the same conditions in the patient. The main chikitsa emphasizing is snehopanaha agnikarma bandhanon mardanani cha snayu sandhyasti samprapte kuryat vaivava tandritaha. Mainly one has to adopt snehana, upanaha, agnikarma, bandhana, mardana. Mainly daha refers to agnikarma, which may be snigdhagnikarma or rokshagnikarma based on the conditions, and snehana refers to bahya and abhyantara sneha and also upanaha. Mainly here I am emphasizing a case study on Sandhigata Vata. So the case study goes on like this. A male subject aged 60 years who is not known case of diabetes, hypertension or any systemic illness with no history of surgery or trauma approached my OPD with complaints of pain in bilateral knee joints since 2 years. Whereas family history was not contributory, occupationally he was bank manager and nothing much stress was there on knee joint. On general examination, all the systems were intact except musculoskeletal system where gait was antalgic. Arms, spines were intact. Other joints were having normal range movements, that is arms joints. Legs, especially right and left metatarsophalangeal joint, ankle joint and hip joints were intact. Mainly the right and left knee joint, on inspection there was no swelling, no scars, deformity or ulcerations. On palpation there was tenderness which was more on right than the left. Crepitation was present whereas swelling and temperature were absent. And all the special tests which mainly indicates either ligament tear or meniscal tear was not present. They were intact and ROM was painful but not restricted. On the Ashtasthana Pariksha, it was Prakrita, Agni was Madhyama, and blood and urine investigations were absolutely normal. Whereas X-ray suggested reduced joint space, which was more in right than left knee joint, suggestive of degenerative changes. The treatment plan was on initially OPD basis, then followed by IPD basis. So here OPD basis, it has been advised to patient for a plan of Sadhyo Virechana, Yoga Basti, Jhanu Basti, initially Rukshana and followed by Snehana and Brumana. For OPD basis, Trayodashanga Gugulu 2 TID after food and Sandharin external application for bilateral knee joint has been advised, whereas almost the same parameters were found in OPD basis on 3rd March 2022. So after 10 days of probably medicines of internal medicines on 10th 3rd 2022, the patient approached IPD, and day 1 and day 2, as I said, was planned for Rukshana therapy. Initially Sarvanga Dashamula Parisheka and Sarvanga Udvartana with Kolakulattadi Churna and Rasna Churna was adopted, where the patient felt lightness all over the body and appetite got regularized. On the day 3, mainly Vatanulomana plays a major role in case of all Vata Vyadhis. So Vatanulomana has been planned with Sadhyovarechana, where Sarvanga Abhyanga with Dhanvantara Taila, followed by Nadisveda and Sadhyovarechana with Gandharva Hastadi Eranda Taila 60 ml with 100 ml warm milk has been advised, where 8 Vegas were observed. On inspection, there was no swelling, no scars, deformity, ulceration, whereas tenderness was still there and capitation was there. Pain was also still remaining. On next course, mainly the Vatahara, Balyabhumhara line of treatment, that is Janubasti with Nirgundi Tala to bilateral knee joints, and Yoga Basti course with Erenda Muladi Niruha Basti as mentioned has been planned, and orally Trayodashanga Gugulu 2 TID after food, Chirabla DS 1 TID after food, and Ashwagandha Ghrita 1 teaspoon BD with first bolus of food has been planned, whereas on day 4, pain reduced by 30% and tenderness was still present, crepitations were still present. On day 5, pain reduced by 50% and tenderness was slightly reduced and capitation were also slightly reduced and ROM was there with slight pain. On 6th, 7th and 8th day, pain reduced by 60 to 70%. On palpation, tenderness was there in right but left knee joint there was no tenderness, whereas crepitations and pain was felt on right knee joint. Day 9th and 10th, pain reduced by 80 to 90% on palpation. Tenderness on right more than left and crepitations was still present. But there was no pain at all on range of movements. So patient was discharged on 19th after a complete course of Rukshana, Snehana, Vatahara, Vatanulomana, Balya and Brumhana, and on discharge advised to continue Trayodashanga Gokulu 2 TID after food, Chirabala DS 1 TID after food, Ashwagandha Krita 1 teaspoon BD with first bolus of food, and externally Mahanarayana Taila for 15 days. And there was 2 follow-up continuously where the medicine dosage has been reduced to BD dose and single dose, and internal medicines were stopped on final follow-up and told to continue the external application, where there was no relapse of pain, quality of life improved. On palpation, there was no tenderness, no crepitation, and range of movement were absolutely normal. So, to discuss the line of treatment of Sandhigata Vata, mainly here in Sandhigata Vata, we have to adopt the Chikitsa Sutra, which has been prescribed by Acharya Sushrita or Yoga Ratnakara, that is Kuryat Sandhigate Vate, Daha Snehopanahanam, or as I said, Snehana Upanaha Agni Karma, and so on. So, here mainly Sthanika Chikitsa plays a vital role, which should be considering of Vatahara, and also the Bahya Chikitsa, Shodhana, and Shamana as a package plays an important role in case of Sandhigata Vata. To conclude, Sandhigata Vata is almost all we physicians with face these conditions in everyday encounter, and patients with Sandhigata Vata is quite common nowadays. So one has to plan the treatment based on the avastha of the patient, based on the Vyadhi avastha, Bala, Agni, Koshta, and then only can conclude the treatment protocol as Shamana, Shodhana. Then Rasayana plays a vital role in Vata Vyadhi. We should not leave Rasayana as Ashwagandha Grita has been adopted. So always the protocol should be based on the individual person but should not be generalized. Thank you.
Thank you, Dr. Saujanya, for your excellent presentation on analytical review of Sandhigata Vata case study. Thank you so much, Doctor.
Thank you.
Next is a poster presentation. I would like to invite Dr. Gopalam Kasturi for the poster presentation. Dr. Gopalam Kasturi, are you there?
Yes, sir. Just give me 2 minutes. I'm setting it.
Sure, doctor. Doctor, please unmute, doctor.
Sir, am I audible?
Yes, doctor, audible.
Good evening, respected dignitaries. Myself, Dr. Kasturi, from Department of Dravya Guna, Government Ayurvedic Medical College, Dr. NRS Government Ayurvedic Medical College, Vijayawada. My topic is about review study on anti-tissue activity of Adatoda Vasika, which is normally called as Vasa in Ayurveda. Introduction. Firstly, I would like to tell you about anti-tissue activity represents the cough suppressant. Introduction. Cough is the most frequent reason for visits to the primary healthcare unit. And then Adatoda Vasika, belonging to the Acanthaceae family known as Adosa, is found in many regions of India. It is an official drug and is mentioned in the Pharmacopoeia of India. Aim. To prove the Adatoda Vasika's anti-tissue property. Then materials and methods. I collected all this data from PubMed, Google and Science Direct, Sci-Hub, Google Scholar databases. And then here I would like to explain about the, this is like animal experiment. This is called as Swiss albino mice, which is used in the experiment. And then Swiss albino mice is taken and it is placed in a 40 microliter of some special chamber. And then ammonium hydroxide solution, it is vaporous gas of ammonium hydroxide solution is given, and this mice is subjected to it. And then it is subjected to particular time period, like 20 minutes gap. It started from 5 seconds, and then it will be till 120 minutes. Like we'll see the capacity of the mice, how much time it can stay there, and then how many types of bouts of cough it is seen there. Once it is exposed to ammonium hydroxide gas, and then after 5 seconds, rats are removed. Firstly, rats are divided into 4 groups. Like after removing, they are divided into 4 groups. In each group, there are 6 mice. Then in first group is like control group. In that we give only the distilled water orally. Then second group is like we are giving this codeine phosphate. Here it is mentioned, codeine phosphate is given. And then dosage is given like this, like 10 mg per kg. Then ethyl acetate extract of Adatoda Vasica. Then methanol extract of Adatoda Vasica. 500 mg is given. Then here we can see the result, like how much like capacity that Vasa is having. Compared to codeine phosphate, it is like almost equal. So by this we can confirm like Vasa is having anti-tissue property. The decoction of Vasa leaves is used in the help of for reducing cough, and then soothing action helps to reduce the irritation in the throat. By this, I would like to confirm like Vasa is having anti-tissue property, and according to Ayurveda, according to Shabda Kalpadruma, Shushka Kasa, it is treated with the Vasa along with Haridra Churna. Bhavna is done. Then later with Madhu it is given. By this I can confirm that this Vasa is used in Kasa. All types of Kasa. Vasa is having Tikta Kashaya Rasa, and then Ruksha Lagu Guna, and then Ushna Virya, Shita Virya and Katu Vipaka. By this, I can confirmly say that according to ancient texts and also according to this research study also, Vasa is given in all type of cough. Thank you so much.
Thank you, doctor. Thank you for the wonderful presentation. Next, I would like to invite Dr. Mayuri Ramkrushna Gondhane for the paper presentation. Dr. Mayuri, are you there?
Yes, sir.
Good evening, doctor.
Good evening, sir.
Please start the session, doctor.
Yes, sir. Good evening, everyone. I'm Dr. Mayuri from PTSR department, Sri Jayendra Saraswati Ayurveda College, Chennai. I would like to present a case titled Optimizing Endometrial Function, a novel Ayurvedic intervention to enhance implantation outcomes. Next slide, please. So 7 mm, this one is the adequate thickness we want. Less than 7 mm has been associated with lower pregnancy rates and with almost no pregnancies observed with lining less than 5 mm. So due to this reason, many patients with IVF failure of thin endometrium have been referred to Ayurveda practitioners for further Ayurvedic management. Next slide, please. Name of patient Bhuvaneshwari and other details are here. So we'll go for next slide due to time restrictions. Cheap complaints with duration. The patient wants to improve the chances of successful embryo transfer. Associated complaints with duration. Anxious to conceive since 11 years. Disturbed sleep since 6 years due to overthinking. Next slide. History of present illness. The patient Bhuvaneshwari, a 37 years old female banker from upper class background, present with a cheap complaints of anxious to conceive, have been unable to conceive for 11 years. She also reports sleep disturbances over the past 6 years due to excessive overthinking. Menstrual history is notable for menarche at age 10 with a regular menstrual cycle occurring every 28 days, lasting for 4 days. Her periods are characterized by clotting, odor, dysmenorrhea, mood swings, irritability, bloating, nausea, leg pain, constipation, increased body heat, and breast heaviness. Next slide, please. So the patient has undergone extensive fertility evaluations and treatments, including HSG, USG scans, hormonal assays, and hysteroscopy. She has also experienced multiple intrauterine insemination cycles in 18 and 19, resulting in 2 pregnancies. One ended in misabortion, and the other is an ectopic pregnancy in left tube. So currently, she is scheduled for embryo transfer procedure this month, and despite ongoing conventional treatment, she seeks Ayurvedic intervention to promote a healthy pregnancy and to minimize complications of medicine. So she has been admitted to SJ Sack Hospital under Dr. Swati Ma'am consultation for this integrative treatment approach. Next slide. So menstrual history, age of menarche 10 years, LMP 25, previous LMP 54, interval between cycle 28 days, duration 4 days, and regular cycle. Intermenstrual bleeding absent. Next slide. Sexual history, frequency of intercourse per week 2 to 3 times, and she's not using any counter ovulation kits to time intercourse. She's using that. Dyspareunia present. Use of lubricants during intercourse absent. Postcoital burning and micturition, white discharge, vaginal itching also absent, and rest of the things non-reactive. Next slide. Personal history, diet, weight, appetite, normal, boiled, regular, satisfactory, micturition, normal frequency, sleep, disturbed sleep, and habits nil, and addiction also nil. Next slide. These are the physical examinations. We'll go to next slide. Ashtavidha Pariksha, Nadi, Vatapitta, Mala once a day, Mutra 5 to 6 times a day, Jivva, Sama, Shabda Madhyam, Sparsha, Anushna, Shrita, Druka Madhyam, and Akruti Madhyam. Next slide, please. दशविध परीक्षा प्रकृति वात प्रधान पित्त विकृति त्रिदोष सार मध्यम संवहन सत्व मध्यम सत्व सर्वरस सात्मा आहार शक्ति अभ्यवरण शक्ति मध्यम and चारण शक्ति मध्यम. Next slide. व्यायाम शक्ति मध्यम, प्रमाण मध्यम, and vaya मध्यम. Next slide. History of past illness, no known case of any thyroid or anything. Next slide. A1 and E1 also present. Next slide. Patient went for hysteroscopy. In that, uterus antivated, normal size and mobile. Uterine cavity, fundal adhesions present. So for that, adhesiolysis done and osteo both seen. Endocervical canal normal. Dilatation of cervix easy and post-operative period uneventful. Next slide. Image for the same. Next slide. Her AMH hormone levels on 510, it's 0.779. Next slide. She went through IUI cycle, 7 cycles. So these are the summary for that. Next slide. This summary: ovulation, induction, follicular monitoring, insemination date, outcome, and management. Next slide. Next. So egg collection was done on 25th Feb and semen freezing also done. Next slide. So per speculum examination, indent cervix, mild congestion present and curdy discharge present. And per vaginal examination, uterus bulky, cervical motion Tedler dress positive and antiverted. Next slide. So these are the nidana for her: stress and daily 9 am to 8 pm sitting in AC room, pradushta artava, bij dosha, ati chinta, maithuna ashishnutva, and disturbed sleep. Next slide. So stress will increase in cortisol level. It affects GnRH. It will decrease LH and FSH. It will decrease estradiol, and anovulation results in infertility. Next slide. So Nidana Sevan will cause Tridosha Prakopa, Agni Dushti. Agni Dushti will cause Ama formation, Rasarakta Dushti, Vaigunya, and it will cause the Artava Srotas, Karyahani, that is a Bijotsarga, and results in Vandya. Next slide. संप्राप्ति घटक दोष त्रिदोष प्रोमिनेंट वात धातु रस रक्त उपधातु आर्तव स्रोतस आर्तव स्रोत दुष्टि संग उद्भव स्थान पक्वाशय मूल स्थान वात अधिष्ठान योनि व्याधि संभव चीरकारी मार्ग अभ्यंतर एंड गर्भाशय. नेक्स्ट स्लाइड. Ayurvedic diagnosis Vandya. Modern diagnosis primary infertility, that is the endometrial factor. Next slide. This was the treatment given: Yoni Pichu with Idumbaraditel, Sarvanga Abhyanga with Dhanvantar Tailam, Bashpa Svedam, Matra Basti with Dhanvantar Tail 30 ml, and Dashmul Arishtam 20 ml BD dose. Next slide. This is the time of administration and retention time. First day 8.5 hours, second 8 hours, third 6 hours, and this 26 5 minutes due to absent of stomach, and 27 8.5 hours retention time. Next slide. Medicines on discharge. Next slide. Dhanvantar Gulika 2 Palasarpi half tablespoon, and Ashoka Arishta 20 ml BD dose. Next slide. Assessment of treatment. Next slide. Next. Next. So these are the before treatment and after treatment. So before treatment, like she's having clots present on day 2, but after treatment, clots totally absent. Before treatment, she's having dysmenorrhea present 2 days prior to menstrual cycle. But in this dysmenorrhea, a significant improvement seen. Mood swings present before treatment. After treatment, mood swings absent. Bloating present 1 week prior to periods before treatment, but after treatment, bloating was absent. Nausea present 1 day. Here nausea absent after treatment. Leg pain present before treatment, after it is absent. Hair stool present before treatment, after treatment it's absent. Body heat increase, after treatment it's not there. Breast heaviness present 7 days prior to menstrual cycle, before 2 days of menstrual cycle, like it worsens. But after treatment, significant improvement seen in the as per like patient statement. Next slide. So how Yoni Pichu will work? Hormonal balance by a bioactive compound of drug, improve uterine blood flow, anti-inflammatory effect, enhance endometrial thickness, and it will enhance endometrial receptivity. Next slide. Yoni Pichu mode of action: inserting Yoni Pichu, it will cause stimulates the paracervical ganglion, afferent impulse, mesenteric ganglion, and its release of hormones primes the endometrium. So this one is the action of Yoni Pichu. Next slide. Before treatment ET 7 mm, and after treatment it's like significant improvement was there, 10.2 mm it is. Next slide. Conclusion: Ayurvedic treatments have been observed to potentially enhance endometrial thickness by improving overall hormone balance and reproductive health. Thank you. Thank you, everyone.
Thank you, doctor. Thank you for the wonderful presentation. Thank you so much, doctor. Next is a paper presentation. I would like to invite Dr. Kadam Ruduja Dharmaraj for the paper presentation on the topic role of Shamana Vishadis in Grahani Roga.
Good afternoon, everyone. Today I am going to present the role of Shamana Aushadhis in the Grahani Roga. These are my contents. Introduction. Samadosha, Samagnisha, Samadhatu, Malakriya, Prasanna Atma Indriya Mana, Swastha Ityabhidiyate. Ayurveda is a science based on the fundamental principles. Ayurveda focuses on identifying the root cause of an illness rather than just treating its symptoms. Agni, the digestive fire, is an important part of the body. The Pitta Kala is located in between the Pakwasha and Amasha is known as a Grahani. According to the Charak, there is a strong interrelation between the Grahani and Jataragni, with Grahani is being the seat of Agni, which is supported and strengthened by it. Importance of Shamana Aushadhis. The approach, however, reverses the damage caused by the disease. It focuses on altering the roga and balances through the administration of a right combination of medications. The approach also involves a change in the diet and lifestyle. Hence, here the Shamana Chikitsa act as a primary mode of care. The main three elements contribute the Shaman Chikitsa, that is herbal medications, exercise and food. Coming to the Samprapti of a armor, due to the Nidana Sevana, Agni Tushti, that is among the Agni will happen, then due to this, undigestion or overdigestion or the fermentation of the ahara will done, and this lead to the armor. Then Samprapti of a Grahani, mainly due to the armor stays in the Mahastotas, that is Anna and Purish Mahastotas, that leads to the Muharbadda, Muhurdrava, Aruchi, Sandhi, Shula, Jwara, Daha, etc. Over the time, this armor accumulates and lead to the poison and acidic in nature, and that's lead to the Grahani Roga. General line of treatment for the Grahani. First treatment should be Grahani dosha involved. Treatment for the Grahani dosha includes the Dipaniya, Pachaniya and Grahi drugs. Dipana drugs stimulates the Agni and Pachana drugs aid digestion of the armor. And Grahi drugs both act as a Dipana and Pachana while absorbing the food. Below mentioned properties of food are given to pacify the ama and it helps in the pachana. That is rasa, kashaya rasa will be used, guna, ruksha guna, laghu guna will use, and ushna virya dravyas and madhura vipakas are used. Coming to the Samana Aushadhis, first Churnas, Dadimashtaka, Hingwashtaka Churna, Hirasanadi Churna, Satyadi Churna, Nagarayadi Churna, Jirakadi Churna, and Amladi Churna. Coming for the Vati, Chitrakadi Gutika, Agni Tunda Vati, Lavangadi Vati, Jati Faladi Vati, Pancha Amrita Vati, Shankha Vati, and Manasamitra Vati are used. Coming to the Kruta, Sundhyadi Kruta, Nagarayadi Kruta, Chitrakadi Kruta, Dashamula, Brahmi, Panchagavya, Kalyanaka Kruta are used. For the Asava and Arishta, Tarka Arishta, Musta Arishta, Pipali Asav, Madhuka Asav, Durlabhadya Asav, Madhav Arishta are used. For the Kashayas, Punanavadi Kasha and Tiktadi Kasha are used. And for the Kwatha, Sundhyadi Kwatha, Dhanyadi Kwatha, Salaparniyadi Kwatha. Shamana Aushadhis are used in the doshas. For the Vata, Dashamula Kruta, Panchamuladi Churna, Amlyadi Churna, Rasanadi Churna are used. And for the Pittaja, Chandanadi Kruta, Tiktadi Kruta, Bhunimbadi Kruta, Churna are etc. used. For the Kafaja Roga, Madhuka Asava, Durlabha Asava, Madhava Arishta, Pipali Churna, Tarka Arishta are used. Coming to the discussion part, Grahani is the sthan of Agni. The term Grahani dosha refers to a malfunctioning and impairment of Agni, which is the digestive fire in the body. It also encompasses all the diseases related to the digestive system. Treating the Agni is a primary focus in addressing the Grahani dosha. Medicines with the Kashaya Rasa, Ushna Virya, Madhura Vipaka, and Ruksha Guna are pacifying the Vata and the Pitta doshas, thereby improving the digestive process. So coming to the conclusion part, the Agni is the primary factor contributing the numerous illness. Then Grahani is an Annavaha Purishvaha Strota Vikara, whereas the Agni hampered. Hence, treating the Agni with the help of the Dipana Pachana Grahi drugs useful. And nowadays, due to the lifestyle changes, Manasik Nidan is also predominant Nidana for the causing the Grahani. And also treating the Manasik Nidana is also important modality of treatment. And after the proper evaluation of the Agni, Ama and Samanya Vishishta Lakshanas of a Grahani, the treatment will be given the great benefit for the patients. So main motive is take care of Agni. Agni will take care of you and your health. So these are my references. Thank you all the staffs and organizer faculty member for organizing the Dharaka 2024. Thank you all.
Thank you, Doctor. Thank you for the wonderful session. Thank you so much, Doctor. Next is a paper presentation. I would like to invite Dr. Ranjit Shankar Sajagane for the paper presentation. You will share the screen now, Doctor. Just a moment.
Good evening, all of you. My name is Dr. Ranjit Shankar Sajagane. My title is Randomized Comparative Clinical Trial to study efficacy of Trivruttadi with Erandadi in Vatarakta with special reference to Gouty Arthritis. Introduction. Ayurveda is a traditional ancient Indian system of health science. In Samprapti of Vatarakta, Vayu and Rakta are vitiated separately. Together they form Vatarakta. Acharya like Charak, Vagbhat and Madhav mention separate topics of Vatarakta. It has separate Samprapti and Chikitsa, while Acharya Susru described Vatarakta in Vatvadyadya. According to modern science, Vatarakta relate to gout. Gout is the most common inflammatory arthritis in men and in older women. It caused by deposition of monosodium urate, monohydrate crystals in around synovial joint. What is the need for a study? Gout is a disease where several types of inflammation seen in distal joint of extremities. In contemporary medicine, mainly NSAIDs and corticosteroids are advised on long term, which hamper liver and renal physiology. There are many side effects for long term use of corticosteroids and NSAIDs. like peptic ulcer, osteoporosis, and suppression of immunity. Untreated gout can cause impairment of joints. The content of Trivruttadi Kwath is easily available, palpable, palatable, and cost effective. Hence, the formulation selected for the present disease review. Acharya Charak explained two types of Vatarakta based on the site of pathogenesis and based on the doshic predominance depending on site of pathogenesis. Uttan Vatarakta, Gambhir Vatarakta, and Ubhayasritta Vatarakta. Drug review. Tivrutta Vidari Ikshurak Vatastranashi. Tivrutta Vidari and Ikshurak are control the Vatarakta. Aim to conduct the clinical trial to evaluate the efficacy of Trivruttadi Kwath in Vatarakta with special reference to Gouty Arthritis. Objective to compare the effect of Trivruttadi Kwath and Erandadi Kwath in Vatarakta with special reference to Gouty Arthritis. To study the clinical textual review of Vatarakta according to Ayurveda. To study the clinical textual review of gout according to modern science. Methodology. Plan of work. Step 1. Drug and disease review. Step 2. Collection and preparation of drug. Step 3. Drug preparation, authentication and standardization. Clinical trial, statistical analysis. Study design. For clinical study, patients diagnosed with Vatarakta will be randomly divided into two groups. One is trial group and second is a control group. Trial groups, Trivruttadi Kwath will be given orally for 1 month. Control group, Erandadi Kwath will be given orally for 1 month. Study of duration, 18 months. Duration of treatment, 1 month. Inclusion criteria, patient with sign and symptoms of Vatarakta are mentioned in Granthas. Patient of age group between 20 to 60 years. Patient selected irrespective of age, sex, socioeconomic status. Patient with hyperuricemia ranging between 7 to 10 mg per day. Exclusion criteria. Patient having sign and symptoms of Vatarakta more than 3 years. Patient with other comorbidities like diabetes mellitus, HIV and malignant hypertension. Patient with serum uric acid level above 10 mg per dl will be excluded. Those patients who are not willing to give consent will be excluded. Patient will excluded below age 20 and above 60 years. Criteria for withdrawal, patient with irregular follow-up, patient who refuse to treatment if any complication or adverse effect found during the period of treatment. If symptoms aggravated during treatment will be withdrawn. Trial group, Trivruttadi Kwath, drug, Tivrutta Vidari and Kokilaksh. Control group, Erandadi Kwath, drug, Eranda Vasa, Gokshu, Guduchi, Bala, Kokilaksh. Group management. Group A 30 patient, Group B 30 patient. Drug Trivruttadi Kwath, Group B drug Erandadi Kwath. Duration same. Dose same. Route of administration same. Oral. Kal Bhojanottar same. Anupan same post-nasal. Follow 7, 14, 21, 28th day. Formulation details. Kwath. Mixture of Bharat Churna, coarse powder of Tivrutta, Vidari and Ikshurak will be taken in 1:1:1 proportion for trial formulation. 10 gram of above mixture will be mixed with 160 ml of water, that is 1:16 proportion. Boil the mixture till 1/8 part, that is 20 ml remains. Filtration will be advised to done. Remaining solid part should be discarded. Subjective criteria. Lakshan, no Lakshan is 0 mark. Mild, 1. Moderate, 2. Severe, 3. Daha, 0 for normal. Mild for can be tolerable. Moderate for constant but can be tolerable. Severe, constant but patient cannot tolerate. Sandhi means swelling. Normal, no. Mild swelling. Moderate swelling plus, severe swelling plus plus. Kandu, normal for no, mild for mild, moderate and severe. Tokavivarna, discoloration, normal for no, mild, slightly reddish yellow, moderate light reddish color, severe dark cherry red color. According to uric acid, objective criteria: normal less than 7, mild 7 to 8, moderate 8 to 9, severe 9 to 10. Oral assessment criteria: 25 less than 25% relief, unchanged; 26 to 50% relief, minor improvement; 51 to 75% relief, moderate improvement; 76 to 100% relief, marked improvement. Consent should be taken. Statistical analysis, statistical tools and measures, discussion, conclusion, and summary. Thank you.
Thank you, Doctor. Thank you for the wonderful presentation. Next is a paper presentation. I would like to invite Dr. Devayani P. Dasa for the paper presentation. Dr. Devayani, are you there?
Yes, sir.
Good evening, Doctor.
Good evening, sir. Sir, is my voice is clear and audible?
Yes, Doctor. Audible, Doctor. Voice is clear.
Yes. May I share the screen?
Please, Doctor. Please share the screen, Doctor.
Is it visible, sir?
Yes, Doctor. Screen is visible.
All right. Thank you so much, Dharaka National Seminar organizing committee members, for giving a wonderful chance to present over here. Myself, Dr. Devayani P. Dasar, Associate Professor from Department of Shalyatantra of Mahatma Gandhi Ayurveda Medical College Hospital and Research Center of Datta Meghe Institute of Medical Sciences, going to present on estimation of efficacy of Agni Karma in Sandhigat Vata with special reference to Shleshmadhara Kala. These are the clinical study prospects with the introduction, aim, objectives, methodology, follow-up, observation, and references. So basically, this Sandhigat Vata is a Shula Pradhana Vedana with a Vatapurna Druti Sparsha and lack of movements, that is the an inability to the movements, having the age occurs after the 35 years, and which we can correlate with the osteoarthritis, which is the second most common rheumatologic problem, having the prevalence rate to 35 to 55% in India. According to Acharya Sushruta, there are the modalities available for the Snehana, Upanaha, Agni Karma, Bandhan, Mardhan with Snayu Asti Sandhi Samprapta Kuryat. Treatment with modern medications having injections, high fever, osteotomy, joint replacement surgery. With the aim basic is the Jaloka Churna in Janu Sandhigat Vata assessment, and also the objective with the study the effect of this Jaloka Churna in Janu Sandhigat Vata. So male and female patient with the age of 40 to 60 years, after taking a Helsinki declaration, after taking a consent as per the Helsinki declaration, and the patient having the symptoms of Janu Sandhigat Vata that are included in the studies, and there is no any diabetes mellitus and other systematic diseases, and no long use of any medication. So here are the materials used for this procedure, that are the local Churna on the affected knee joint, weekly once for the 6 weeks, and these are the materials required for the procedure with the follow-up of 2 weeks. So this is the Jaloka Churna found most efficacious parasurgical procedure in this knee joint pain, that is the Sandhigat Vata. So in this one, just I took out a little as the sample size is less 10, that is it can be considered as a pilot study. And for this is male and female ratio I just depicted in this slide, and in result there is a good for the 9 patient, and for female patient there are 3, fair and poor, that is depicted in the slides. So highly significant result in reduction of the pain, and some of the female patients that are also reported after Agni Karma after the 10 years of their treatment. Means once, for example, if I did in this year, so one of the patient reported after 10 years that she is getting a mild pain. So this is a really very good effective procedure in this one. Significant results in the swelling and tenderness, and also marked improvements seen in 6 patients, and remaining are improving. So it is maybe effective treatment for the rapid reduction of the pain, also reduces symptoms of osteoarthritis, and functional recovery is very fast one, and potential of being additional and alternative therapy treatment of osteoarthritis. So Jaloka Churna found effective in this one. It may definitely prohibit the high tibial osteotomy with further surgical corrections, and easy to do and cost effective than the surgical corrections. These are the references. Thank you so much, the organizing team, for giving this chance to me. Thank you so much.
Thank you, Doctor. Thank you for the wonderful presentation. Thank you so much, Doctor. Next, we go to the next presentation. I'd like to invite Dr. Abhishek Dattratray Mavale for the poster presentation on the topic Ayurveda meets artificial intelligence, tradition and technology for a healthy future. I'll share the screen, Doctor, just a moment.
Good evening, respected teachers, and good evening, all of you. It's my pleasure. Ayurvedic College Hospital and Research Center, Salem, Hirapur, Wardha, under guided by Dr. Devani Dasal, Associate Professor, Department of Shalya Tantra, Mahatma Gandhi Ayurvedic College Hospital and Research Center, Salod, Wardha. Now today my poster topic is Ayurveda meets artificial intelligence, traditional and technology for the healthier future. So let's start with Ayurveda overview. Ayurveda align with your Doshi constitution. Ayurvedic Dincharya to maintain balanced life. Ayurvedic herbs and plant-based remedies to support health and well-being. Ayurvedic treatments like Panchakarma, detoxification and rejuvenation process. Ayurvedic practices like meditation, mindfulness and Panchakarma, pranayam means breath control are the recommended to maintain emotional and mental balance. Now let's start with artificial intelligence. Artificial intelligence included neural networks, machine learning, and deep learning. Now the role of artificial intelligence in healthcare are enhancing patient care, data privacy, and security. In advancing public health, initiatives, ethical and legal consideration, human interaction, and diagnostic assistance. Now, power of and artificial intelligence in Ayurveda, artificial intelligence used in big data in Ayurveda, artificial intelligence for drug discovery in Ayurveda, collaboration between artificial intelligence and Ayurvedic practitioners, artificial intelligence impact on Ayurvedic clinical trials, advancements in Ayurvedic research, quality control and safety assurance, predictive analysis for formulation and development, artificial intelligence in supply chain management, artificial intelligence for Ayurvedic lifestyle recommendation, artificial intelligence for future prospects of Ayurveda. Now, let's go with personalized health recommendation. Dosha analysis. Artificial intelligence can analyze a person's physical and psychological traits to determine their dosha, means body constitution, and suggest personalized dietary, lifestyle, and treatment plans. The symptoms analysis. Artificial intelligence powered tools can evaluate symptoms reported by individuals to recommended specific Ayurvedic treatments, herbs, or therapies based on traditional knowledge. Ayurvedic herbs and drug interaction databases. Artificial intelligence can be used to create comprehensive database that track potential interactions between Ayurvedic herbs and modern pharmaceuticals. This can help practitioners avoid adverse effects and enhance treatment efficacy. The diagnostic tools, pulse diagnosis, artificial intelligence could be trained to analyze subtype variations in pulse, means nadi parikshan, reading, offering a non-invasive and accurate diagnostic tools that combines traditional techniques with modern accuracy. Image recognition. Artificial intelligence algorithms can be used to recognize pattern in skin condition, tongue, or iris, aiding in diagnosis and treatment planning. Virtual consultation and educational tools. Learning platforms. Artificial intelligence driven platforms can offer personalized learning experience for students for Ayurveda, adapting contents based on their progressive and areas of interest. Knowledge repositories. Artificial intelligence can curate and organize information from classical Ayurvedic texts, making it more accessible and earlier to study. Mental health support. Artificial intelligence can assist in offering guided meditation, breathing exercise, and mental health support tailored to individuals' doshas and current mental states. Now, hereby, I conclude my poster presentation. When Ayurveda meets artificial intelligence to create a healthy life and healthy future. Thank you so much.
Thank you, Dr. Abhishek. It's a wonderful presentation and relevant topic. Thank you, Doctor. Next, I would like to invite Dr. Hridesh Sudhakar Bhonde for the presentation. I'll share the screen, Dr. Hridesh, just a moment.
सिंहस्य नान अप्यमानस्य सुश्रुत वेदांस्ता 30/59 रूप कंडनात्मकः क्षिप्रं स्फोटः स्रावच्च जायते एकीभूतं रणघोरं तं विद्या अहिपुतनम्. सुश्रुत निदानस्थान 40/60. लक्षण शक्रुन्मुत्रे समायुक्तो अधौत अपानि शिशुर्भवे स्विन्नस्य अन्नपानस्य मानस्य कण्डु रक्तोत्कपोद्भवे कण्डुयन्यत् ततः क्षिप्रं स्फोटास्त्रावस्य जायते एकीभूतं रणघोरं तं विद्यात् अहिभूतम्. सुश्रुत निदानस्थान 30/59/60. Contemporary. The word dagger is the name of
Just a moment, doctor. We will call you next, Dr. Ridesh. Now we go to the next presentation. I'd like to invite Dr. Vineet Vijay Rajpure for the presentation. Dr. Vineet, are you there? You will share the screen now, doctor. Just a moment. Please start the session, doctor.
Good evening, everyone. My name is Dr. Vineet Vijay Rajapure, PG Scholar Student of Chalakya Tantra Department from Honorable Sri Anna Sahib Dange, Ayurvedic Medical College, Ashta. And I am here to present a case on Jirna Pratishay treated with Anutailnasya, Nasa Vayu Vivaran Lep, and Sarvadik Chikitsa. So the introduction is Nasa Roga have been described widely by all the Acharyas. Acharya Shushruth has described 31 Nasagat Rogas. Amongst them, Pratishay is one of the most important diseases. In today's era of technology, our lifestyle has rapidly evolving due to the dietary changes, improper sleep patterns, rigorous job profiles, and stress leading to various types of lifestyle disorders. On the basis of signs and symptoms, the disease Jirna Pratishay can be compared to the chronic simple rhinitis in modern medicine, characterized by the symptoms which are Nasa Avrod, Shirashul, Nasa Srav, Angamarda, Shavathu, and Aruchi. So the case study which I have taken, the patient details were a 27-year female patient having the symptoms of Shirashul, Nasa Srav, Angamarda, and Shavathu since 5 to 6 months, which were on and off. The patient didn't have any surgical history or the known case like DM and HTN. Patient's history was always taking aharas like hot and spicy foods and drinks 4 to 5 times in a week, consuming oral contraceptives since 1 year, a stress of work, and persistence of nasal infections like sinusitis and all. Then the examination, Ear canal was very clear, but the tympanic membrane of bilateral ear was retracted. Nasal examination seen like nasal mucosa was very congested, bilateral inferior turbinate hypertrophy was seen. And in throat, posterior pharyngeal wall was mildly congested and posterior nasal drip was seen. Now let us turn to the part of the Chikitsa. In Chikitsa, as we already discussed, Nasa Vayu Vivaran Lep was given for 7 days. The dose was BD for 7 days, which was followed like Sthanik Snehan Svedan was given, and Snehan was given with Tela Tela. Nestle with Anutel was given 8 drop in each nostril for 7 days. Abhintar Chikitsa included Naradiya Lakshmi Vilas Ras 250 mg, 2 tablets, BD for 15 days. Trikatu Churna 3 grams BD 20 minutes before food. Amrita Arishta and Patyadi Kwath 4 tablespoons each BD after food for 15 days. So the mode of action of my Ayurvedic drugs were as follows. Nasavayu Vivaran Lep had mostly contents like Vacha, Musta, Shunti and Yashti Madhu, and whose actions were Shothagna. Anutail, as we all know, it is a very strong Shungatak Nasa Netra Shoshahar. Naredi Lakshmi Vilas Ras, it has many contents like Abrak Bhasma, Parat, Gandhak, etc., which has the actions like antimicrobial properties, Tridoshagna, antipyretic, expectorant, antiseptic, and stomach activities. Trikatu Churna, as we all know, it is Shuntamiri and Pimpali Churna, which is Ampachak, Deepan, and Ras Dhatu Agni Mandihar. Amrita Arishta, which contains Guruchi, Dashamu, Jirak, Trikatu, Nagarmutha, Nagarkeshar, Kutki, and Indraji, which is Agni Mandihar. Patyarishta, its action is Jirna Amadoshar. So the absorption of drug was as follows. As we all know, the olfactory pathway, the olfactory cells get stimulated by the drug administration. Stimulation carried the further through olfactory axons across the cribriform plate of the ethmoid bone, axons of the olfactory bulbs. These bulbs from the axons synapses with dendrites of the mitral cells. Many such synapses form the olfactory glomeruli. From olfactory glomeruli, axon of the mitral cells continue to form olfactory tract and finally reach the end in the olfactory cortex. Now, let us see the observation and the results given to the patient. The patient was under observation for 14 days and assessment of the subjective parameters were made by interrogating the patient on each 7th day. Now, the shear shoe on the first day, as we can see here, was plus, which after 7 days was reduced to a single plus, and after 14 days it was absolutely nil. Nasa Straw on first day was plus, after 7 days it was also only a single plus, and after 14 days it was nil. Angamarda on first day it was plus, on 7th day it was nil, and on 14th day as well it was nil. Same like Shavathu also on first day it was plus, after 7 days it was nil, and after 14th day it was also nil. Aruchi, which is anorexia, on first day it was plus, after 7 days it was nil, and on 14 days as well it was nil. Nasavro, that is nasal obstruction, on the first day it was very severe, so it had plus, on 7th day it was reduced to plus, and after 14 days it was nil. Let us come to the part of the discussion. Acharya Shushrut describes Nidanas of Pratisya as Kalantarjanak and Sadhyajanak. Sadhyajanak Nidanas can be compared with aggravating factors. Doshas are whited and Havaiguni is created due to the Kalantarjanic Nidanas, and repeated contact with the Sadhyajanic Nidanas causes a recurrent attack of the disease. Stages of Pratisya are Amavastha and Pakvavastha. If these stages are being left untreated or mismanagement of these stages leads to the severe and more complicated stage, that is Jena Pratisya. Acharya Vagbhat has stated that root of every disease is Mandani. So due to Agni Mandya, Sara Dhatu also leads to whitition of the doshas. Due to these factors, it becomes very difficult to treat the disease. The word rhinitis means inflammation of the mucous membrane inside the nose. Inflammation is brought by the bacteria, virus, irritants, or allergens. Mucus is the fluid that the nose produces. Normally, this liquid is transparent and thin. It prevents the inhalation of the dust, debris, and allergens. Dust, pollen, bacteria, viruses, irritants, and allergens. Things that causes allergic rhinitis can all be trapped in mucus and avoid, which leads to rhinitis. In response to these irritants or allergens, body cells release histamine and other chemicals. According to Ayurveda, Vata and Kapha dosha become violated as a result of consuming food high in Vata and Kapha prakopak ahar and vihar. Individually or collectively, these violated Vata Kapha doshas build up in the siras, spread to the nose, and result in Pratisha disease. Samprapti Pratisha holds that the predominant doshas in this system are Vata and Kapha, so management should be based on specifying these doshas as we have done in our case study. Thank you so much.
Thank you, doctor. Thank you for the wonderful presentation. Next, I would like to invite Dr. Hridesh Sudhakar Phonde for the presentation.
Good evening, everyone. My name is Dr. Hitesh Sudhakar Bhonde. I am a PG final year scholar. I am a pediatric student, and today I am going to present my subject, which is ahiputana, means napkin rash. The first introduction of ahiputana is one of the common disorders found in the pediatrics. It is developed due to the vitiation of pitta, kapha, and rakta doshas, which can be also known as gudakutta, Prushtaru, Matruka dosha, and Anamaka. According to Acharya Vagbhata, due to the Mala Upalepa or due to Svetatva, Kapha dosha and Rakta Dhatu get vitiated and produces Vrana at Guda Pradesha, which is Tamravarni by nature, also due to the Dushta, Stanyapana, and Asuchita. That is unhygienic condition. The disease developed at the Guda region is known as ahiputana. Ahiputana in modern science correlated with napkin rash. Need of study. According to Acharya Vagbhata, due to Mala Upalepa, Svedana, Kapha dosha and Rakta Dhatu get vitiated, and which leads to ahiputana. Hence, the proper understanding of Samprapti and its Vigatana plays important role in Chikitsa of ahiputana roga. Therefore, attempt will be made to work on Kanchana Dvokachurna Lopa. Audumbar Churnalep is also mentioned in Bhavprakas. The contents are easily available, cheap, and affordable. Review of literature. The literature will be taken from Ayurvedic classical granthas, modern literature, articles, or text, and relevant research work concerned with the subject. The positive factors, pathogenesis means samprapti, types, classical signs and symptoms, Purvarupa Avastha, Praktyatma Lakshanas has been mentioned. Detailed description of various herbal formulations yoga given for the management of ahiputana. Ayurveda references: Shushrut Sanhita Nidansthana, Shushrut Sanhita Chikitsastan, Ashtanga Hridaya Uttara Tantra, Ashtanga Hridaya Sutrastan, Ashtanga Sangraha Uttara Tantra, Kashyap Sanhita, Sharandar Sanhita Madhyam Khanda. And the contemporary textbooks are Textbook of Pediatric by O.P. Ghai, Nelson Textbook of Pediatric, IAP Textbook of Pediatric, K.D. Tripathi, Essential of Medical Pharmacology, and Harsh Mohan textbook. चिन्हस्य स्नान आप्यमानस्य सुश्रुत निदानस्था 13/59 रूप कंडनात्मकः क्षिप्रं स्फोटः स्रावच्छ जायते एकीभूतं रणघोरं तं विद्या त अहिपुतनम् सुश्रुत निदानस्था 40/60 लक्षण शत्रुन्मुत्रे समायुक्तो अधौत अपाणे शिशुर्भवेत् स्विन्नस्य अन्नपानस्य मानस्य कंडु रक्तोत्कपोद्भवेत् कंडूयन्यत् ततः क्षिप्रं स्फोटा स्रावस्य जायते एकीभूतं रणघोरं तं विद्यात् अहिपुतनम् सुश्रुत निदानस्थान 13/59-60 contemporary review. The word diaper is the name of not named because the diaper itself caused the rash, but the rather because the rash is associated with diaper use, being caused by material trapped by diaper. Allergic contact dermatitis has also been suggested, but there is a little evidence for this cause in adult with incontinence, means fecal or urinary or both. Drug review. कांचनात्वकचूर्ण कांचनारो हेमोग्राही तुवर श्लेष्म पित्तनुतः कृमि पुष्टगोदभ्रंश गंडमाला व्रणापह भाव प्रकाश निघंटू गुड़च्छादि वर्ग /103 कंट्रोल ड्रग औदुंबर त्वकचूर्ण सर्वोच्च पित्त व्रणजिच्छस्यते गुदकुट्टके primary objective to compare the effect of Kanchanar Tvakachurna Lepa and Audumbar Tvakachurna Lepa in the management of Ahiputana with special reference to napkin rash. Secondary objective to assess the effect of Kanchanar Tvakachurna Lepa in the management of Ahiputana, special reference to napkin rash. Second one, to assess the effect of Ahiputana, Audumbar Tvakachurna in the management of Ahiputana with special reference to napkin rash. And the third objective is detailed study of Kanchana Tvakachurna Lepa, Audumbar Tvakachurna Lepa in Ahiputana. Method of selection of criteria of study subject. Inclusion criteria. Child having symptoms of Ahiputana like Prana, Strava, Kandu, Pidaka. Children of either gender irrespective of socioeconomic status. Age between 1 to 2 months to 24 months.
Thank you, Dr. Ritesh. Thank you for the wonderful presentation. Next, I would like to invite Dr. Kedan Krishnan Dainje for the paper presentation. Dr. Kedan, are you there? Dr. Kedan, are you there? Just a moment, doctor. We'll share the screen, doctor.
Good evening, one and all. I am Dr. Krishna Painful, who is from the Randomized Comparative Clinical Trial, Maharashtra. Today I am going to presenting in front of you a case study on epistaxis with special reference to Vatarakta. First of all, we have to see what is epistaxis. The definition of epistaxis is bleeding from the nose as a result of variety of causes ranging from insignificant trauma to malignancy is known as epistaxis. The blood loss during epistaxis will from few drops of blood to the massive bleeding. Nose is richly supplied with branches of internal and external carotid arteries. Case study: a 64-year male patient presented in ENT for the complaints of nose bleeding since 5 minutes. He states that he has been facing this type of nose bleeds once or twice in a day for past 1 week. On further inquiry, he revealed his medical data, which is non-significant. No any past medical history or surgical history. The whole case will be presented in short format. Subjective evidences: a 64-year male patient presented with nose bleeding in ENT since 10 minutes. He has no past history of any kind of nose bleeding. He has no family history of any kind of nasal bleeds. Objective evidences: on examination, pulse was 90 per minute, BP 130 by 96 millimeter of mercury, SpO2 98 with room air. On enter-rhinoscopy, it revealed bleeding from little area. Systemic examination was non-significant. Assessment: based on subjective and objective evidences, this patient was diagnosed with epistaxis. Definition: bleeding from the nose as a result of variety of causes ranging from insignificant trauma to malignancy is known as epistaxis. Risk factors: due to age factor, atherosclerotic changes could be the reason for epistaxis. Clinical presentation: nose bleeding since 5 minutes, occur once or twice a day since 1 week. Anxiety, no significant pain noted. Management: patient was made comfortable by counseling, local examination done, bleeding noted through little area. The nose pinching done for up to 10 minutes. After a moment, the bleeding started again. Then we let the impure blood out. Then Vasasaurus nasi is given 4 drops in each nostril for 5 days. Vasadi Gritam 10 ml with warm Godot given as abhyantara medicine. Follow-up taken on 5th day and final assessment done on the 5th day. Symptoms relieved and patient was satisfied with the treatment. This is the clinic picture of patient. On arrival, we have done nose pinching and did nasal packing up to the medicine preparation for the time being. Medications are wise. Vasasaurus nasi 4 drops in each nostril for 5 days. Abhyantara chikitsa given. Vasadagritam 10 ml with warm cold. Maintain hydration. In case of any kind of discomfort, bleeding from nose, he was advised to visit the ENT OPD ASAP. Discussion: Vasa is indicated in Rakta Pitta as it has thick Kasharasa, bitter and astringent essence, Laghu Rukshaguna, light and dry qualities. Shitavirya, that is cold potency, and Madhu Vipaka, sweet taste after digestion. In epistaxis, the site of bleeding is nose. Application of the Vasasaurus, which is Kapha Pitta in nature, gives symptomatic relief as well as the Rasapachak of it help in breakage the pathogenesis. Vasadi Gutta, which have ingredients of both Kapha Pitta drugs and Shita and Guna. Godukdes Madhurasa Vipak, Shitavirya, Rasayan, and Rakta Pitta Shama. Hence, we used Godukdas Anupana. Conclusion: epistaxis is a condition causing concern due to the blood loss involved in it. Many times it is just the panic of patient which calls for medical attention. There was significant improvement in the episodes of epistaxis after 5 days of treatment. This case reports concludes that Ayurvedic management of Nasya and Vasagrita Abhyantara offers a good result in the treatment of epistaxis. Thank you.
Thank you, doctor. Thank you for the wonderful presentation. We have come up to the end of today's session. As we conclude the first day of the Dharaka National Seminar 2024. I want to express my deepest appreciation for your active participation and engagement throughout today's presentations. Your insights and contributions have truly set a high standard for the rest of this seminar. Today's sessions have provided us with valuable perspectives and reinforced our commitment to advancing the field of Ayurveda. I am confident that the knowledge shared today will resonate with each of us as we continue our work. I would like to extend my heartfelt thanks to all the representatives and for their thoughtful and enlightening contributions. Your dedications to this field is inspiring and is crucial to the continued growth of Ayurvedic science. Let us carry the momentum and enthusiasm of today's into our next session. I look forward to seeing you all again on the second day of the seminar, where we will continue our journey of learning and discovery. Until then, thank you once again and have a wonderful evening. See you the next seminar. Thank you so much.